All right, everybody. Thank you for joining us for our April 15th, 2026 regular council meeting for the city of Courtenay. I'd like to first by acknowledging that we respectfully acknowledge that the land on which we're gathered is the unceded territory of the Comox First Nation, the traditional keepers of this land. And also we do have a proclamation, and I'm not sure that I actually have the proclamation in front of me. So with, yeah, I don't think we have the text of the proclamation, but it's World Primary Immunodeficiency Week from April 22nd to 29th. And, but I'm sure the proclamation will end up up on Facebook and the website or somewhere up there, and we'll you can get your information about it there. Any introduction of late items? I don't believe so. And so we'll move into the adoption of minutes, and I believe we can do the 25th and 27th together. And are there any errors or omissions? Seeing none, we'll accept them unanimously for council, and we'll move on to our delegation, starting with it's the Courtenay Mobile Integrated Community Response with Leslie Howie, and it says Faringa Yu, and Inspector Scott Mercer, Constable Greg Hall, and Kathleen Ferran. So I think that covers everybody. If you'd like to approach the podium, and we'll go into your presentation. And just a sec, I'll put your microphone on, and your microphone is good to go.
Well, thank you and good afternoon for the opportunity to present in front of council our initiative, the Mobile Integrated Crisis Response initiative that we began this past fall. And with me to help present with this initiative is Director of Mental Health Substance Use, Leslie Howie, our manager for the mental health substance use, Sabina Atchison, Island Health Psychiatric Nurse Tara Whiten, RCMP Mental Health Liaison Officer Constable Greg Hall, and our RCMP Criminal Analyst Kathleen Ferran. In November 2024, the Comox Detachment began early discussions with the City of Courtenay on non-traditional policing methods that could benefit the Comox Valley. Between January 2025 and February 2025, these conversations led to dialogue with Island Health Medical Health Officer Dr. Charmaine Enns, and later North Island Mental Health and Substance Use Service Director Leslie Howie on the possibility of creating a local initiative to help address rising mental health concerns in the Comox Valley. Observable data revealed an increase from 3% to 10% call volume and workload for crisis. In April 2025, RCMP town halls led by myself with municipalities identified mental health as a prevalent community issue and a focus of concern. In May 2025, Comox Valley RCMP and Island Health continued meetings to discuss options for funding with respect to a collaborative initiative to address frontline mental health concerns. The Ministry of Health supported this idea, but could not provide the funding commitments at the time. Informing the City of Courtenay of our intent to create the micro team consisting of a mental health trained police resource and a psychiatric trained health resource, Courtenay CAO requested a proof of concept before any funding considerations could be made. From May 2025 to September 2025, an agreement was made between Island Health and Detachment to allocate one full-time equivalent from each agency for a period of 6 to 9 months. This agreement led to security clearances, training equipment allocation, defining role and responsibilities, as well as an MOU review. On September 20th, 2025, Island Health Mental Health and Substance Use Services, Comox Valley and Comox Valley RCMP launched a 9-month proactive initiative to meet mental health concerns at the street level and demonstrate its value to the City of Courtenay and the greater Comox Valley. Micro consists of 2 persons. As said before, our registered psychiatric nurse, Tara Whiten, as well as our mental health liaison, Constable Greg Hall. Their interim work schedule is 4 days on and 4 days off from 7 a.m. to 1900 hours. Because we are currently utilizing in-house resources to make this initiative work, we had to be cognizant of current workspace needs and respective resources. The hope and plan is to provide more even coverage throughout the week, with the possibility of expanding the micro program to 2 police resources and 2 health resources, allowing day, night, and weekend coverage.
So for some of you may not be completely familiar with MICAR programs. Really, MICAR is an extension of the crisis nursing program that's already in existence in Comox Valley Hospital. So there's the various types of resource, whether it's phone assessment or direct consult with police or apprehensions under the Mental Health Act. So they have kind of a range of services. And what the MICAR program does is really bring that specialist nursing right into the community alongside a RCMP officer. So the kind of the idea or the objectives when we set out were really to look at how we could reduce the number of RCMP presentations with individuals at the emergency department. So we kind of looked at it from both perspectives, like what would we hope to achieve, which would help release some pressure on emergency. And also to try and ensure that those who were admitted did meet mental health thresholds for admission into hospital, so that we didn't have this high level of presentation to emerge and then people not being admitted. We also wanted to enhance mental health engagement with people who were in crisis but are heading towards crisis in the community, rather than waiting for them to present to MHSU in the community or for acute care. So trying to kind of come upstream of it from the emergency response. And then we also wanted to increase the number of transitions to community teams. So there are people in the community who are not connected to MHSU community teams, and by being able to intervene in the moment, we can often help transition people to community services. And for the RCMP, the two of the objectives were to reduce the number of calls for frontline RCMP with respect to mental health, so to focus it in the car, and then to reduce the time waiting in hospital for assessment from crisis, because crisis is a busy service. I have to say our hypotheses weren't quite met, but they were met in different ways, which is a good thing. So we kind of anticipated that by bringing the crisis nurse out into the car, that we would be able to clarify what interventions were needed and kind of enhance transitions, and then maybe reduce wait times, but also reduce the number of people showing up at Emerge. And that we would also increase the admissions to presentations, which gives us a sense of how appropriate it is that people are turning up. If only 1 out of 100 that turns up gets actually admitted into mental health care, then we're not picking up the right individuals. This just really looks at what we've done in the time since September 2025, and I think it's a real it's a testament to the people who picked up on the initiative and actually got it into place, which was Sabina and Tara and Greg just doing this work and being out there in the community. So I'm going to skip on because I know that we're short of time. So what we anticipated was that we would actually see a decrease in people presenting to the emergency department with requiring mental health and substance use assessments. And we actually didn't see that happening. What we saw was that the addition of the MICAR program actually increased the number of people we were seeing. So the emergency presentations kind of stayed the same, but we increased by almost 90% the number of people that were seen in a day and over that 6-month period. So these calls that were being picked up in community were actually accessing a slightly different population who hadn't maybe accessed service before or who hadn't come into emergency before. Overall in that time, I have a couple of numbers here. So the 6 months, the same 6 months in the prior year, we had 912 crisis encounters, which isn't the same as interventions. But in the 6 months in September 25 to April 26, we had 1,000 crisis encounters plus almost 500 crisis encounters with MICR. So there's overall in the community, there was a bit of an increase, and then we were accessing a lot more people through the CAR program, which is a good thing. We also saw that the number of people coming to, so of those 495 encounters, approximately 41 of those were apprehensions under the Mental Health Act. So that helps people who are required to be recalled into hospital. And what that does is decrease the overall pressure of recalls from RCMP as a whole into a focused team who understand the process and can bring people in quickly. The other thing that we saw with individuals was that there's a number of individuals who frequently would attend hospital for their care. And really, unless you need your require emergency medicine, attending emergency department is not the place for you to receive that care. And so there isn't like a large enough data set to show this, but individuals who were frequent flyers to the hospital are receiving much more of their care in the community because MICR is there to offer that care kind of at the where the need arises. That's just a repeat of some of those numbers. There we go.
So from the RCMP perspective, the objectives that Leslie set out, since the first shift on September 23rd, 2025, MICR has worked on 109 police files and conducted additional oversight and follow-up 219 times. 75% of these files occurred in the city of Courtenay. Between October 2025 and January 2026, the MICR team did as many mental health apprehensions as a general duty watch. 58% of the files MICR assisted were mental health act or check well-being. And as we've seen in our previous APP quarterly reports, those seem to be the increasing files, especially when we're talking about the downtown files in the city of Courtenay. To do a community breakdown of that 190, Courtenay had 142 files, Comox had 30 files, and Black Creek, Denman, Hornby Island, Fanny Bay, Merville, Cumberland, and Royston combined for the provincial areas accounted for 18, which was about 9.47% of the total amount, while the town of Comox had 15.8%. So 75% was attributed to that of the city of Courtenay for our work. Since the first shift on September 2023, the total number of police hours spent in hospital for mental health apprehensions was lower than the previous 2 years. Between January and March, the total number of police hours spent in hospital for mental health apprehensions was 40% lower in the same months than the previous year. Approximately 69.7 hospital admission hours have been returned back to the front line. MICR introduced itself to the Comox Valley mental health community and made long-lasting professional relationships with ACT, AVI, Island Health, Island Mental Health, departments into School District 71, North Island College, CAF 19 Wing, Health Services, Probation, BC Prosecutor Service, and local judges. The outcome of this program has surpassed our original hypothesis and objectives. Some of the benefits of MICR can be summarized in 3 main points: enhanced client care, coordination with partners, and maximizing resources. With respect to enhanced client care, the capacity of MICR to follow up with clients is a fundamental difference from other frontline units that are primarily focused on responding to calls for service. Follow-ups by MICR enable the team to assess when clients' behaviors are destabilized from what is their baseline. MICR routinely advocates for clients to receive appropriate resources within healthcare and at times quicker access to these resources than through traditional policing processes. The time needed to proactively build rapport with clients is not usually possible for general duty members who are pressed to respond to calls for service. MICR's ability to establish relationships with persons experiencing mental health crisis have been pivotal in their program success. In addition to assisting clients experiencing mental health issues, MICR has been able to provide support family members. This includes education on Mental Health Act, the process of apprehension, access to care, as well as safety planning. With respect to coordination with partners, the integration of a mental health nurse with an RCMP member has resulted in streamlining the transition of clients from police custody to the healthcare system. In November 2025, one RCMP member noted that they only spent 9 minutes in hospital with a suicidal individual before they were able to get back to the road. This was largely due to Micro's ability to prepare and receive the client at the hospital. Micro makes it possible to bring mental health resources to clients who, without stabilization, are at risk of escalating behaviors that would bring them into the criminal justice system. Micro has participated in consultations with BC Prosecutor Service with respect to psychiatric assessments. These assessments have been helpful on how clients may be better supported by probation in the community. Micro has established connections with CAF 19 Wing Comox healthcare staff to establish agreements regarding how Micro could support them and access the base. This has led to assistance with military members in a manner that is less intrusive to base operations and maintain the members' privacy in the community. With respect to maximizing resources, since Micro started working in September, the number of hours spent by RCMP in hospital with individuals apprehended under the Mental Health Act were significantly lower than hours recorded in the same month in the previous year. Micro is able to conduct and facilitate home visits between healthcare workers and clients. RCMP participating in Micro increased the safety of these situations. The complete cost of individuals' mental health issues that can escalate to greater police involvement goes far beyond the hours of police time invested. Tumbler Ridge mass shooting was a national tragedy. Family of the shooter stated that they had struggled to access help for mental health concerns, even though the shooter had been apprehended by police under the Mental Health Act. We had a recent experience lately involving a lockdown at a school in which there was threats of violence. Micro was able to deploy with our members once it was seen and provide access and connection to healthcare to the person that was under investigation. Micro program needs. Frankly, we need your support. This initiative is currently operating on in-house resources. The detachment cannot support long-term without backfilling, and municipal funding is required. As the slide dictates, 1 full-time equivalent provides partial coverage, while 2 full-time equivalents provides full week coverage. Before any discussion on potential funding could occur, the detachment and Island Health were challenged to provide a proof of concept to demonstrate both feasibility and need. Within 6 months, we have reallocated fixed resources, stood up a unit with skilled professionals, and put together a comprehensive and proven model that is making a difference in our communities. From a policing perspective, this pilot project has been possible from using much needed general duty resource elsewhere to demonstrate its value. This initiative has created a prolonged vacancy on our front line that needs to be backfilled. Our service delivery cannot afford to accommodate this program in its current form without serious discussion on long-term funding. The current project cost of a full-time equivalent police officer is approximately $258,000 per year. That's not lost on us. Understanding the financial commitment for just one policing resource will give us partial coverage. Ideally, I would want our micro unit to have 2 full-time police resources and 2 full-time health resources dedicated to provide 7 days a week coverage with potential extended hours into the evening. Right now, we have a gap in our micro that is being felt across several watches that do not get to experience the benefit of having this skilled team work on their lines and provide assistance. The NIMO RCMP has recently moved from a 2-person team to a 4-person team to ensure they provide adequate coverage throughout the week. Our current vacancy rate is 7 hard vacancies and 15 soft vacancies. That's 21 out of 30 general duty members, 70% vacancy rate. Final note that I would like to mention before concluding our presentation is that today we received a report from the RCMP on stratified intelligence report, which came out. One of the points that mentioned was expand integrated mental health co-response teams. That they left it up to the RCMP to advocate for continued expansion and funding of integrated co-response units or CAR programs. The rationale for this was the contributing factor analysis identified the mental health and addiction crisis as a significant driver of public disorder and assaults. These co-response teams are a critical tool. They ensure a more appropriate and effective response to individuals in crisis, reduce the burden on patrol officers, and decrease the likelihood of an event escalating to a criminal or violent outcome. In a nutshell, this program works. It is making an impact. We are seeing community wellness improve, and we're saving time and money, but it needs commitment, and it needs commitment from this municipality. if you don't take my word for it, I've provided letters of support from all the community partners that we've been able to reach out to and establish partnerships within this short period of time. We've provided this as an appendix to the City Council for consideration. These are just a list of the names and agencies that we've been able to obtain a letter of support that feel a need to continue this program long term. And that concludes our formal presentation. We are more than happy to entertain any questions and provide any answers that the council is wishing to seek from us.
Excellent. Thank you so much for the presentation. I was wondering how you'd get that all in 10 minutes, but the 18 slides came in just on under 20 minutes, but I think really well worth it, and really appreciate the presentation today and the detailed information. It helps us quite a bit with that information. I do see that we have a question or comment from Councillor Elaine, so I'll pass it over.
Thanks, Mayor, and thanks to both of you for presenting today. I'm glad to hear that you've had success with this model. There's two things that I don't understand. The first is 3 or 4 years ago, we did a fair amount of work to help deliver what was then called the Peer Assisted Care Team to the community. It's now called CIRCLE, which I believe stands for Crisis Response Community Led. And I thought they were going to do what you've just described. So I see them on your list of agencies in the community that you're in touch with. So I'm just wondering if you could explain where the overlap is, or where the division is between what that group does in terms of responding to people having a mental health crisis on our streets, in our communities, versus the micro team.
Well, I can certainly speak from the police perspective, and then I'll leave it to Island Health to explain the health perspective on it. From the police perspective, that these calls of service that are coming in to us when it's a check well-being or a mental health concern, there is always a public safety element that needs to be met first, right? If there is nothing for the police to handle and is identified as a health-related item, and we feel that it's more appropriate to go through, say, our local health professionals, then we'll liaise with them. If there is, and we have explored opportunities and had opportunities with the community response, community-led group to come in, and we've advocated their use on things that don't meet either threshold for our agencies as such. So when there is going to be some overlap within the community, but I view that mental health within this community to be varied. There is a high risk that's associated to some of it, and there's some that require direct access to medical needs that necessarily can't be met by other advocate groups. And I can turn it over to Island Health to speak to the necessity of their role.
Yeah, I think it's very similar. I think the crisis team, the microcar, has the nursing and health assessment and the health record right there. And so if CIRCLE were working with someone, because it's peer-to-peer and it's more counseling, they would then call on the car to come. So it's kind of a different level of acuity and a different level of need. So like mental health apprehensions, they could only be done between RCMP and nursing. So it's a different part of the population. Or some of them will be the same. I would say that people could access both, but the specific services offered are different from this kind of program.
Yeah, I appreciate that. I mean, I always worry about people with different hats on doing essentially the same work, and how we end up sort of spreading out the work into little sections where I do this part, you do that part, and we all talk about that in human services, the development of silos and such. But my primary question beyond that is, I really appreciate all the agencies that are supportive of the work, but I don't see any of them providing a rationale, nor did I hear it from you specifically, why the city should fund this particular service, which essentially is a mental health need. And our residential taxpayers primarily expect us to fix the roads, provide the sewers, certainly provide policing services, but I worry about us taking on what essentially is a provincial mental health responsibility.
It's a valid concern. The point that I would maybe make is that these calls for service are coming in at a police level, that there is a police required response for many of these, persons that are undergoing psychosis that are acting out in a violent manner, or there's a concern for safety. That's not something that we're going to refer to a peer group to handle. It's the de-escalation of this behavior. It's the monitoring of this behavior. It's the ability to connect them with the appropriate health services. And at times there's a need to apprehend these individuals because they demonstrate a harm to themselves or others. So the rationale for it is we're starting to see an increase in these calls or these related calls for service within our community, and we need a specialized service to deal with them. Our general duty members are ill-equipped to handle calls of this type of nature that start to go into the health realm, that our role needs to be minimized, but we need to make safe for them to get to it. We are trying to establish a partnership with Island Health in terms of them getting the health resources that they need and the funding as well, and to prove this concept to them. But ultimately, we're going to need a police officer that is equipped to handle this. This is a proven concept in other communities as well. This, while I understand there's money that has to be put towards this, has been able to be proven to be quite effective in de-escalating violence on the street, as well as providing immediate care to people and then not getting trapped into the criminal justice system as well as the policing system.
Thanks very much, Councillor Hillian, and thanks for the answer. And next is Councillor Frisch.
Yeah, thanks, Mayor. and Thanks for the presentation. Yeah, you certainly make a good argument for having a more efficient form of policing. I know we've talked about community policing over the last decade, and this sounds like it kind of fits that bill. And to Councillor Hillian's point, I guess if no one else picks up the responsibility for mental health and addiction, then we're left on the front lines without a lot of choices. But you were suggesting that 2 more police officers would basically make like a full-time complement to this service. Is that kind of valley-wide you're looking for 2 more, or
Well,
what are your thoughts on that? Like, would you?
I think currently in our current model right now, there's an identified gap, right? We have made this service available to the entire Comox Valley, and we understand that the ask is coming directly to you for funding on this particular one resource that we're looking at. Our goal is to get 2 for it. We would be seeking additional funding from other persons, whether it's from the other municipalities as well, to understand the need of this. I think that what we're being able to provide with one resource is adequate. And we've seen other municipalities with larger numbers make do with just one resource. I would be more concerned about what are we able to do in the times that we're not working. If I had a perfect world scenario, I would ask for 2 police officers as well as 2 health resources. But as far as the workload that we're seeing right now, currently, it is majority that's occurring within the city of Courtenay. There is options for me to present to other municipalities as well, as far as the value, and have them contribute towards a full-time equivalent member. And we have seen this cost sharing before when we've done forensic services and such. But currently right now, considering this was an idea that was discussed with the city of Courtenay as a pilot project, and I have mentioned it to the other municipal leaders. There is value, but I would have to present this model and this data to them to get them to contribute towards it as well. I see this as a Comox Valley problem, not necessarily just a city of Courtenay problem. We share our resources. We're an integrated police force. Therefore, there's value in utilizing these resources elsewhere. But ultimately, we also have to be responsible as far as who's contributing towards the money and making sure that it's a fair and equitable cost share as well. But from the data that I'm seeing currently right now, the majority is certainly coming from the city of Courtenay.
Yeah, fair enough. I'm glad you see the reality there. We don't collect a toll on the way into Courtenay when people want to use our services. And we are the center of the Comox Valley economically, I suppose. But yeah, it would be really nice to do this on a regional level for sure. Thank you very much.
Thanks, Councillor Frisch. And maybe as a quick follow-up to that. So and I can't remember the exact numbers. I was writing them down as you were going, but there was that sort of electoral areas, Cumberland portion of it. So would there be an ask to the province that funds those to, again, do that cost sharing? Is that what I heard you saying?
Well, again, as far as the purpose of presenting this today, it's to you guys. We would have to approach the other municipalities as well as the province, understanding the difficulties of trying to leverage funding for those type of positions once we get into the province as such. But I do see a value of this being solely, and again, if we just want to limit our abilities to say it's just going to work within the city of Courtenay, and that's the direction of this particular council, that's where you want to see your money invested in, then we can also put restrictions as far as where we use micro. I just feel that mental health in itself is a larger problem, and we should try and share when we can. But there are also funding options that we can find that if they are being utilized in other communities, we can bill that back and JV those costs back to the other municipalities as well. So there is an ability to recover costs too. But I mean, that's getting a little bit longer in the tooth as far as how we determine who's going to fund and how this is going to be paid for. And I'm more than happy to further those conversations with this particular council.
Excellent. It sounds good. And actually sounds like a great topic for the elected officials forum that we've been talking about, where we can bring all the municipalities together. Was it a follow-up, Councillor Frisch? I do see we have Councillor Morin online, and then we also have Councillor Jolicoeur and Councillor Frisch here. But Councillor Morin, I'll let you go first.
Thanks, Mayor. Can you hear me okay?
Loud and clear.
Okay, super. Yeah, I have a few questions, so I know there's people waiting, so I'll try to squeeze in one, perhaps two. Thanks for the presentation. First of all, it was great to see the outcomes that you described. Good collection of data, which is always great. So I guess I'm curious with some of the savings in time and the savings with your members not having to attend at the hospital for as long, and some of the efficiencies that you've described. I'm wondering if there's consideration to reallocating existing staff, at least for a partial, because I guess I'm curious if this has been saving time for your members. Yeah, I'm just wondering whether an existing staff member could be reallocated as sort of that mental health, that primary mental health role.
Thank you, Councillor. Well, we did this in the short term, feeling that we'd be able to provide the proof of concept needed to satisfy this council's concern as far as if this would be worth investing the money in. The reality of our situation when it comes to our operations is when I highlighted the vacancy rate, I should have emphasized the fact that 21 out of our 30 general duty people, those are vacant spots right now. We don't have the ability to reallocate for something. So the hours that are being saved, there is time and there is efficiency, but it doesn't translate straight across into the amount of time that's being saved by this car translates into one body being removed from the front line as such. It's creating efficiencies, but not enough to substantiate the loss of a full-time member for that. I do want to highlight that our division data analyst came out with a report, or at least some information that was provided to us, that the city of Courtenay has the highest number of files per member of municipalities with populations over 15,000 in British Columbia. We are 2 times the provincial average right now. I've had to collapse support units for our detachment. Our bike unit is now rolled back into our general duty to cover for calls for service. Our crime reduction unit is now into general duty to cover for calls for service. So I've limped along this pilot project in the hope that we could have consideration for funding on something like this, because I do feel the value of this this position within this community. I do feel that it's making an impact, but we also need to have a frontline member replace the member that's doing the specialized service. So long and short, I understand what we could look at doing, but it's just not possible with our current operational picture. And we need the backfill for this program to go on in its current form.
Yeah, thanks for that. I guess the vacancy issue is an ongoing problem that I'm not sure how that's, because that's not necessarily I guess the city's dilemma around the vacancy piece, but I appreciate the answer. I guess my other quick question, if it's okay, Mayor, or do you want me to get back into the queue?
I'm getting thumbs up. I think that you can do another
Okay.
question. One
Sure.
more question.
Yeah, and then just in terms of the 75% being Courtenay, I guess we don't really have any way of knowing where those folks reside, because we know that people do come from other areas into the city for services and then, you know, experience mental health crisis. So I guess that's one question. And then whether there's been tracking, you know, we don't want to create further stigmatization, but, you know, you know, are folks attached to a resident, or are they primarily, you know, not attached, and that's contributing to the mental health crisis that we see? I guess I'm curious about the geographical aspect, because I think that once again, I would like to see some help from the rest of the region if people are actually, you know, living or centered in other areas of the region, but are ending up, you know, downtown or wherever they're ending up.
Well, I can get those answers for you. When I say that 75% of the calls are occurring in the city of Courtenay, our largest population that we're dealing with when it comes to migrant is the unhoused community. And the downtown problems that we're facing here. So to tie it to where they may be originally coming from, as far as looking for, you know, assistance to help fund, I don't think is going to resolve the issue at hand. But I could also turn that over to our data analyst, as well as our actual micro team, to say where the majority of their time is being spent and the people that they're dealing with, largely in just like a globalized fashion. I will go back to your earlier point where you're talking about the vacancy rate, seeing that it's not, you know, solely the responsibility of the city of Courtenay. I agree in part with that statement that, you know, when it comes to vacancies, we're not just talking about hard vacancies where they're open staffing shortages. We're talking about soft vacancies. This is the long-term ODS situation that I've described at this council when it comes to the constant wear and tear that's happening on our members. Our members are going off for a long period of time, from 6 months to a year, and it's because of the workloads, the crippling workloads that we're facing when it comes to the calls for service. It's why that I highlighted that at the beginning, that we're starting to see the effects of this, and it's now affecting us long term to the point where we're having to collapse units to backfill just for the calls for service to be met in this detachment. So for us to reallocate when we're at full strength, I don't know when full strength is going to be until we get a serious conversation as far as the adequate policing that we need within this community, but that's a separate conversation at hand. And
Okay.
I'm not gonna conflate
Thank
with this initiative.
All right, thanks, Councilor Moore. And if you have other questions, you can leave your hand up, and I'll circle back once we go through the room here again, and I'll pass it over to Councilor Jolicoeur.
Yeah, thanks, Mayor. And I'll have also a set of questions, clarification questions, but maybe just to start off by saying thank you for the work that you do in the community. I've had the opportunity in a past life as a nurse working in this space, mental health and substance use. And so I know how the folks that you're working with, sometimes it's the worst day of their life, and the families that are around that person. So thank you for that work. And the other comment I wanted to just say, per the inspector, I think it's really valuable, the cross learning that happens. I think having a specialized officer who then is sharing those skills, and they're often really important, what's known as soft skills, but they're emotional literacy skills and trauma-informed practice, goes a long way for the rest of your officers, I imagine. So thank you for that. I'm actually going to start with my questions to Leslie, if that's okay. We did hear about 258,000 for one policing resource. It's been a while since I've been a nurse, but if you can speak to the costs for you, and specifically, this is a reallocation. We've been talking about reallocation for policing resources, but this is a reallocation of a acute crisis team member up at the hospital. And I'm wondering if you can speak to the operational impacts of that specifically.
Sure. Yeah, so the costs are similar-ish in terms of resource. If we're talking about one or two resources, the costs between RCMP and nursing are kind of similar, maybe a little bit more, but similar amount of money. So what we did was we had some discussions with the Ministry of Health at the time we were talking through the the pilot or setting the initiative up. And their stance at that time was that additional funds wouldn't flow into the health authority, but as a health authority and as an MHSU regional program, we could look at reallocation of resource. So we did look at reallocation of resource locally, and we shifted some schedules and did some backfilling if it was to continue. So there has been some impact and need to backfill up at the acute care site because the numbers haven't, it wasn't a straight exchange. We'll see this many outside and this many inside acute care. So there has been a need to cover that gap that was left there, just to support the workloads for the other staff. If we're looking longer term at filling it, we'll have to look more broadly into the regional programs. We have some reorganization that's happened, and so we would look at as MHSU as having crisis as kind of a crisis response, or MICR as an essential part of the services that we offer. And so we just have to look a bit broader than Comox Valley or my portfolio, but as a health authority have agreed to look at where we can reallocate resource on a longer term basis to support these programs.
And
But if the police resource isn't there, we won't do that.
yeah, the costs, do you have an estimated cost for the resource?
For 2 resources, we're probably looking around $300,000. So you can just half that for one.
And thanks for that. And so I'm just trying to paint the picture, Mayor, if I can, just one more clarification question, then I'll get back in line. Prior to the MICR program, we were having acute care nurses go out into community for the Mental Health Act forms alongside a police officer for the apprehension, the Form 10s, Form 9s.
Yeah,
And so this was happening I'm just trying to understand what was happening previously.
Yeah.
And it goes to the inspector's point around his regular duty officers were likely attending those. And so I'm just trying to understand, maybe if you can paint the picture of what was happening prior.
Yeah.
This work was happening, officers were going with nurses
Yeah.
to apprehend individuals. So if you can kind of paint that operational picture for us.
It was happening, but in a bit of a different way and with less intensity. So before MICR, nurses would go, they would be called out by our CMP, and they would go as like a second. So they would basically get in their cars, go to the scene, but sometimes we're left sitting around, this is described very well, sitting around the corner wondering, are the police here? Should I go? What should I do? So often people were brought in just with our CMP. And when we look at we started the conversations with Scott, when we looked at the amount of work that Crisis did, they're 100%. Only 3 to 5% of that was actually with our CMP, right? So what it did was with education, we increased the amount of partnership, and then with MICR, we've increased it just so many fold. So that work wasn't happening in the same way, but it was happening.
Yeah, so it's an operational practice change.
Yes.
Okay.
Yeah.
Okay, thanks.
Yeah.
All right, thanks, Councillor Jolicoeur and Councillor Frisch.
Sorry, can I just jump into
Yeah,
that last
absolutely.
point that the councillor raised? So as we mentioned or not, the apprehensions in itself from hospital is just a small portion of the work, right? That we were doing. And largely when RCMP officers were attending calls without the assistance, say if it wasn't a form that was issued by the hospital and we were responding to a call for service, the officer themselves was making the determination as to whether that person needed to be apprehended under the Mental Health Act or not. And there is so much risk that's associated with that decisions are being made in the field that have a civil risk to it as well as a public safety risk to it. And I can say largely, well, at least anecdotally, that our decisions were not always great when it came to this. Having specialized service like Greg and Tara in the field, the member goes to assess the call for safety purposes, and then they make the determination with the psych nurse as to whether that individual actually needs to go to hospital or doesn't. And they can speak to the frequency of that as far as how many times they've been able to defer that person or connect them to other resources, or find that they're along their baseline because they've had that interaction, that connection. They've accessed those medical records to understand more about the patient, more than what a general duty officer could potentially have in there. So that's what I say, is that our safety net has increased tenfold when it comes to having this unit out in the field, and it reduces the decision making that, to be quite honest, I would like to take off the hands of the general duty member and have them handle the more apt and trained things that they're supposed to be doing out on the front line to begin with.
Thanks for that addition. Councillor Frisch?
Yeah, thanks, Mayor. I was interested in hearing a little more about the vacancy rate, and from what I'm understanding is you're suggesting that we're under-resourced in general in the valley, and that your members are perhaps burning out. And so 2 questions. Could you just repeat for me what the vacancy, I thought I heard 21 out of 30, but that doesn't seem possible. What the vacancy rate is here, what it is in other, BC municipalities.
So what we have is we have a 64 full-time equivalent detachment. 30 of those members are dedicated to the front line in general duty. I'm saying that out of the people that are long-term sick, that generate the soft vacancies, as well as our own hard vacancies, which are open vacancies for people that are awaiting transfer to come in, those are all frontline. There is maybe 1 out of, it's actually 22 out of 30, but it's 21 that's general duty, and it's 1 that's associated to our support.
You have 2/3 of your front line are actually off
right now. And I can say that the city of Courtenay contributes to 50% of our authorized strength of the Comox Valley. So that's 31 of the 62 positions, while approximately 72% of the Comox Valley RCMP files occur in the city of Courtenay.
Yeah.
And we're having the other municipalities, such as the town of Comox, as well as the provincial areas, subsidize and have to offset that workload, and their resources are being utilizing within the city of Courtenay to offset the workload that's being increased in that city alone.
Yeah. Well, thanks for the insight. I'm actually not opposed to talking about increasing funding for RCMP. But I completely disagree with the concept that we take the calls that occur in Courtenay and we ask Courtenay residents to pay for that. I mean, it's like everything that goes on in the valley, probably 70% of it happens in Courtenay. You get in your car, you drive into Black Creek all the time. No, you're coming to Courtenay. So it makes sense that all the calls are in Courtenay, because all of the resources are in Courtenay, all the businesses in Courtenay, most of the grocery stores are in Courtenay. So all the arts, and I mean, I'm not saying that the other communities don't have stuff going on, but I just think it's not a great argument to say that the calls are coming from here, so Courtenay has to jump in. I think we look at this valley-wide and we say, Courtenay's population is this, and if it's 50%, then we should be doing 50%. If it's 60%, let's do 60%. And if we just need more police officers, let's look at that valley-wide and say, well, we'll throw in whatever our percentage is and get you more police officers, but let's do it valley-wide. I think that's the right way to think about it.
Well, and I would agree with you, but unfortunately, the municipal contracts and the provincial contracts don't work that way when it comes to jurisdiction and population. Again, further argument that we can, I can say that from the soft vacancies and hard vacancies this year, it's a $750,000 refund that's coming to the city of Courtenay with a $1.5 million budget surplus from all the vacancies. So that's money that's being returned.
Okay, well, thanks for that.
And maybe just do another follow-up on that one. And this is a question that comes up again, sort of that vacancy versus creating new positions for members. So if, let's say, in a perfect world, 2 positions are paid, however that happens, what is the likelihood of those positions getting filled as well? Because it's one thing to have the positions, but it's another thing to fill.
Out of the hard vacancies, like I said, we had, I believe I said 6. Is that right?
I had 7 plus. I just had 21 written down, and then Yeah, it wasn't.
Get
able to
lost in
keep
my
up.
own numbers sometimes. So out of the vacancies that we have, so we have 4 candidates that have been identified that are coming, and we're just waiting for them to be staffed. So we've got 2 vacancies right now, in which we've got a cadet that's also being tapped from depot. So it is a greater likelihood of staffing the general duty vacancies than it would ever be for the specialized services, because you're looking for a specialized skill set for those individuals, right? So for someone like Greg, who's been in the role, that is trained with the that we need for this, it would be easier for him to obviously take on the full-time Miker or someone with the equivalent training within our detachment, and then backfill it with a general duty member that we can advertise throughout the province and as well as nationwide. So it's easier to staff on the general duty front.
Okay, thanks. That helps with visualizing how that'll work. Councillor McCollum has jumped in, so I'm gonna let her go next.
Yeah, thanks, Mayor, and thanks for coming today and providing this presentation. There's a lot of really good information here, and I think it's really important for us to hear about the impacts of this program and how it's improving how we do policing and mental health services in our community. One question I had just around this kind of relationship between the gap in the what we're funding for frontline service members and vacancies. It's a larger proportion than I thought, and especially when you kind of hone it into really who's providing that interface with the community. But what I'm not really understanding is, so if we proceed and add another FTE to address this, to provide kind of better around the week schedule or around the day schedule, how would this position not end up being impacted by this vacancy issue that we've been talking about? How would we know by adding another FTE that this won't be sitting as a vacant position like the rest of them?
So with the pilot project, the person that we have currently in the role, they would be the Miker member. That would be full-time, and we would just be backfilling Greg's vacancy that we've had to reallocate over to fill that Miker position. So then that would be the general duty member that would occupy his previous role and return back to the front line.
And so is it not 2 FTEs that to run the program? Or?
That would be my goal, would be to have 2, but realistically, just to keep it functioning right now long term, we would do one FTE so 1 full-time member right now, which could be Greg. If that was the wish as a council, if we, my ask is 2, but we could get by with 1, but full week coverage, then we would again have to advertise as far as who has the skill set to fill that other vacancy that Greg wouldn't occupy in the Miker. And there is enough trained personnel within the island that I would be confident that we'd be able to fill that. And then we'd be able to do the general duty backfill that we would need in-house if we were to staff in-house instead of outside.
Okay, yeah, thanks. That's helpful in my understanding of what we're trying to address. The other comment I just wanted to make was just a few moments ago, you were pointing out that the higher number of service calls in Courtenay is essentially asking or requiring a subsidy from our neighboring municipalities in terms of where our policing services are being used. And I mean, I understand that there is a data point that would point to that, or I'm sure you're not pulling that out of thin air, but I would also point out that a lot of when we see, when you provide our quarterly reports, a big piece is the courthouse, which we don't have any control over. And then we are providing a lot of services in downtown Courtenay for folks that end up, I mean, in the presentation that we're talking about right now. And I would push back and say that our neighboring municipalities are more than happy for Courtenay to continue to provide the services in this location and have those calls happen here.
For sure.
And not be provided in their location. So I would just emphasize that I think it's widely understood by the entire Comox Valley where these services are needed, and most people would not like them relocated closer to them so that policing resources are more fairly distributed. I'm sure that they're more than happy to have the police come and respond to those court calls
And
in
I'm
downtown.
not gonna disagree with your point on that, Counselor. I mean, I've heard it from other people that, you know, what stays in Courtenay is probably better in Courtenay than happen elsewhere. That being said, it was just a point that I was trying to make, that even with the critical workload increases that we're facing, we are subsidizing with other areas to backfill. So I understand the higher point that you're trying to make is that that you know, those communities are happy for it to occur here. Therefore, they're not going to fight back to get their resources. But there might be a time and place when the town of Comox, you know, gets busier and they will want their resources and stuff. And they're going to, you know, when they're the ones that are responsible for the municipal contracts that they have to pay and the amount of members, and they're trying to pinch pennies and stuff and curb costs. I'm just trying to highlight that at the end of the day, when it comes down to it, the integrated policing model works, but I don't think we should be splitting hairs specifically at this particular point is where they come from, because it's a slippery slope when it comes to the other communities as well. Because they could say, well, that's fine, we'll take our members back and you guys can struggle on your own, and then see where the chips fall, which I don't think is the best way forward on something like this. I think the collaborative way that we're doing things right now is the best way to move forward. And when it comes to this particular initiative, which, to get back on the point for me, is that I do feel that this is a value added initiative. This thing that we've created that has highlighted the amount of good work that we've been able to do in just a short period of time, to me, is worth the money and the investment on it. Because while we're asking for something to backfill a vacancy that Greg has created, the amount of work that Tara and Greg have been able to single-handedly accomplish on their own in the past 6 months has been invaluable for a lot of our external partners. And we're seeing it make an effect on our members on the floor as well, as far as taking that pressure and stress off of them, and to have them come in and give them a context as far as what those people are enduring on a day-to-day basis is changing relationships within this community.
Yeah, that's great to hear, and thanks for sharing that.
You can come.
If you would approach the microphone, just so that the counselors online and those that are all the millions of people watching right now
Great.
can see it.
Hi, I'm Tara. I'm the nurse of this operation. What I just would like to add for context is I think we can all sort of see the visible needs in our community. I think Greg and I working together in this initiative, what has sort of become apparent to us is the less visible folks in our community that require sort of assistance. There's definitely a need in the senior population where we're having calls from GPs, we're having community members reach out, neighbors reach out to us. So it's just not sort of one section of the population that this is funding. We are talking to your grandmothers, we are talking to your aunts. There's a need in the community for folks to receive health care that aren't able to access it, that don't have sort of folks to advocate for them. And I think that's another sort of, part of what Greg and I are doing in the community that might not be sort of picked up in our sort of in this presentation yet today. So I just wanted to point that out. Thanks.
Thanks so much for that. It's much appreciated.
Hi, I'm Sabina, the manager of MICR, and I would also just like to speak to the demographics regionally, because what we see with mental health is 1 in 5 or 1 in 6 people in communities across Canada living with mental health disorders. And when we start an initiative, we are often focusing on what is the most visible concern and access points where people can get the support that they've been seeking for a long time and have not necessarily found the bridge into health services. And what we would know to happen if we projected growth over time is if a service like this continued at the rate it is going, we might see as high as a 300% increase in response to crisis calls of the nature we're receiving now. But with more publicity, when something is becoming a regularized program, we do also see advancement in the amount of usage by a broader demographic set. And so when we have people present at Emerge or we have people present with MICR, the population is already diverse. And then when we have an individual who is presenting in the downtown core, they might also be attached to 5 to 7 individuals who are also struggling to help support that individual, who the micro team is able to provide additional supports to families, community members, or other businesses in how they might better help that person to receive supports, and then decrease. We'll probably see a decrease in that nature of calls and an increase in broader calls.
Thanks very much. I will just do a time check that we are at 5 o'clock, which is for us a long time for a delegation, but I don't want to curb the discussion necessarily. But I should have also mentioned at the beginning that we don't make decisions based on delegations on those dates. We usually comes forward at a future time. But with that being said, I believe Councillor Morin is next.
Thanks, Mayor. I think this is one of our, obviously our high profile issues that we deal with. So I don't know if it warranted an hour-long conversation, but I definitely think it's an important topic. I wanted to just say that I'm really appreciative of Tara and Greg and the work that you've been doing, and everybody else. We know that those on the front lines are doing really difficult work, and it's valuable work. So I just want to make sure that I express that gratitude. My last question was around part of, I see a few outcomes that council would like to see, and that's the piece around the public safety perception that's out there. But me personally, I'm very I'm looking for those personal outcomes as well. I mean, I don't think we should be criminalizing mental health and substance use, and I think that this kind of model does help alleviate that. So I guess my question is, because if we decide at some point to provide more funding, I'm wondering if if there's been much public feedback beyond the letters that you provided from people that citizens who have had your help. I'd like to know whether businesses and other people are what you've seen in terms of their perception of whether public safety has improved, I guess, basically.
I think the best persons to answer that would probably be Tara and Greg, if they want to take a moment just to talk about their experiences with the people that they deal with in downtown core, the business as well, all the outreach that you guys have done and the partnerships that you've established that might be outside of these current letters of support that might speak to those concerns that the councillor is raising.
Yeah, thank you very much. I can't speak to statistics or anything like that. I don't know about the business community. We don't have direct conversations with the commerce. But what I can do is speak to families who I think almost daily we're told about the significant impacts and how grateful they are to have us present and us available as an option in the community. We are dealing with such a wide range of people every single day. Some of these situations can be very volatile. I think by bringing in, the right people, the right attitudes, the right personalities, that has allowed us in all the interactions we've had to never have a situation turn poorly. We've been able to de-escalate people time and time again, have a positive outcome. The number of times I've interacted with people that talk about how horrible of an experience their last apprehension was with the police, and we are able at the end of it to shake hands. They're thankful, they're grateful for that experience. I've policed for 18 years. I've done so many different jobs. I've never felt a greater impact on the community than I have in the last 6 months. It's been so great for me to experience. You know, I've always been very proud to be a police officer and the work I've done. And I'll be honest, me as an individual, some of the things that come with policing, especially in our past, sometimes are difficult for me to deal with and reason with. This is the first time as a police officer, I have been proud of what we do daily, and I am proud of what we do and what we're representing on the street as police. I think we are making a massive difference, and I think it's going to continue to grow, and it's going to be just incredible to families. It's going to be a stress relief to families to know their loved ones are cared for and safe when we arrive.
Yeah, I think just if you haven't seen us out in the community, I have a vest that says nurse on it. There's been a number of calls that we've gone to where clients will look and see a nurse, and it just instantly sort of de-escalates the situation. Safer for the client, safer for the police. It's just safer for all of us. I think I can go out and bring a trauma-informed lens to the work that we do, the work that needs to be done. Oftentimes, like I said, we're apprehending seniors at times. I think it's supporting their families. It's supporting them when we take someone to hospitals to have a connection to continue to interface with them in terms of.
If you could just go a little closer to the microphone, because we have folks online as well. Thanks. Sorry.
I can let people know where their loved one are in the system in terms of, like, we've arrived, they have a point of contact. It allows me to sort of be out in the field, prepare the hospital for what we have coming. It just allows integrated care. It allows Greg and I to go out when we're responding to a call. I have a health file in front of me. I can see if somebody's connected to a team already. So we often can call the team and have them show up for us. And support when we're talking about doing assessments. You were asking previously about the CRCL support. We can augment each other nicely. There's times that we'll go to a call that's called in 911. Greg and I can arrive. We can assess the scene, assess for safety and risk. And if all our sort of criteria are met in terms of this is someone that we can leave at home and not have to take in the system and to connect with community resource, we will call CRCL and have them come and offer support, and they can stay longer. They can provide sort of the care in the moment. It allows Greg and I to, even the next day, stop by, check in. Oftentimes these calls aren't just one and done. They're people that we check in, and oftentimes in the community we can support them, and then oftentimes we know when to intervene and bring them to hospital. It just allows more complete care for an individual.
Councillor Morin, just I've had personal conversations with Greg Chadwick from the BIA and have informed him of this program. He's aware of it, and they know to call us and how to reach out if there are persons that are affecting the business core that he feels that may be experiencing a mental health crisis. So the information is out there, and the outreach is there, and we're always looking to expand and improve on that as well. But I do think that that this is going to be a benefit to the downtown area.
Thanks for that. And thanks, Councillor Morin, for the question and for the detailed answers. And I think just for council's benefit, I think what will likely happen is we'll have a meeting with staff, maybe even myself, after this with the RCMP, because this is a pretty big topic. And it's an ongoing conversation I have with the other leaders in the community as well. So I think there might be some conversations that can happen. But with that, I will politely request that the last two questions come forward, and then we'll move on with our meeting, and we'll pass it over to Councillor Jolicoeur.
And I'll make it easy. I actually only have one question and then a comment. But I think the length of this conversation really demonstrates the importance of this issue in the community. And so I appreciate everyone holding on for the length of and lots of learning here. My question specifically to to both of you, I guess, just the list of support letters. I read through all of them. They were all written to us and the ministry, so provincial folks in the city of Courtenay. And there's been lots of conversation, I think lots of data here for us to go away and talk about things like vacancies and the complement related to Comox and Courtenay, and then the provincially funded officers. And so are these letters of support also going to go to Comox and the province? Like, is there going to be a pitch to those two groups? Just because they were all written to us specifically.
So because the delegation was presented to the city of Courtenay, because the idea started initially with me and Mr. Garbett on this whole pilot initiative to begin with. The provincial component, as far as the letters, that was to speak to the Island Health side of the house, because they are in charge of the funding if they're looking to seek additional support. So I wanted to present those letters firsthand to this municipality, given that our delegation is directed to you. And then depending upon what conversations we have afterwards, say with the province side for Island Health, that they're already pre-written, so we're not asking people to write letters twice on this.
Yeah, and I think, Mayor, just the thing that comes to mind for me, and I appreciate that, you know, and you had it in your slides there around your town halls where you heard feedback from the community. That was really reflected in this council's directive to you and your officers around our priorities, which highlighted these issues as key priorities in the community. We hear regularly from citizens around these topics, and so I was a little surprised to see the presentation come forward, given we had to kind of directed that this work be done given the existing complement. So for the additional ask it's a lot to take in, and I'm really happy to hear about some of the specific data points, and I look forward to seeing something maybe a little bit more formal coming in. It's helpful to understand the operational impacts for both Island Health and our detachment here. And what I would say as well that I think is a key piece here that wasn't mentioned is that we are very lucky in this community to have the Comox Valley Substance Use Strategy, as well as the Substance Use Collaborative, which is made up of all those folks. I think you have an officer that attends that, lots of Island Health folks, and this city has endorsed those recommendations. This program, specific program, was not part of that. Circle was. We were very lucky to have that. We're the second round. And so I am looking forward to hearing a little bit more from them to see around that integration. So I was happy to hear some of how that's happening, because really what we were at least initially sold on that program was that that program was going to address many of these issues, not the safety issues. Of course, they would call your officers to address safety issues. So I'm looking forward to seeing how this all integrates into the makeup of all the services in the community. So thanks for being here.
For sure.
Thanks, Councillor Jolicoeur and Councillor Frisch.
Yeah, thanks, Mayor. I'll be quick. I agree. This is obviously a super important topic, and that's why it's taken us over an hour to get through it. I just wanted to clarify that I really think we're on the same page here. I don't want to get caught up into who's paying, just that we want to move forward in a really collaborative sense. So this initiative seems really important. Personally, it seems like something I want to figure out how we can continue on and make this happen. But I'd really just love to not just this be about Courtenay, because it's just not about Courtenay. It's about the whole Comox Valley. So that's all I'm really looking for. And I think your point about the letters, if we just address this as the Comox Valley needs these services and how can we get them, I think we can move forward more easily. Thanks.
Thanks very much, Councillor Frisch. And I don't see any questions. I'm not going to wait for any more. So with that, I do really want to thank you for giving some fulsome and detailed information today. It's very much appreciated. And for actually just moving ahead with this project and getting it underway so that we can have these data points. So, I mean, that's the whole point of pilots. And I think it was done quite effectively in this case. So really appreciate it. And then we'll be following up probably very quickly and then see how we can move forward.
I appreciate the time for council here, and again, stressing my earlier point that while we know that this isn't the appropriate venue to seek for funding commitments or anything like that, but we do need to talk about the urgency of and the sustainability of this program, because currently right now it's running out of runway for us.
Yeah. Fair enough. All right. Thanks very much. Appreciate that. And all right, so you guys can, you can stay for the rest of the meeting. You're welcome. Hopefully every topic won't be an hour, but we're going to move on to a presentation from the Comox Valley Chamber of Commerce. And Tracy Clark is going to give us a presentation on our business retention and expansion. No, there's like most of our gallery. So Tracy, whenever you're ready, I think your clicker should Be clicking.
Okay, there it is. So click. There we are. Okay, thank you. It's good to see everyone. Thank you, Mayor and Council, for having me, and hello, staff. 2+ years ago, Council invested in understanding the real conditions that are facing our business community. And today I'm here to share what we learned and why this work is even more important. So you've entrusted this work to the Chamber, and I want to acknowledge that this is being delivered by a nationally accredited organization with strong reach and trusted relationships across the business community. We've had a great year receiving some acknowledgements that you can see on the screen there. You've seen this slide in our previous updates, and today we'll talk about what's happened, what's evolved, and what's planned for the remainder. So we started with broad engagement and data collection, and we wanted to understand the real conditions that businesses were facing. And then we followed that with analysis, and that helped us identify the key themes and the priorities. From there, we moved into planning, and that helped us translate what we learned into targeted actions and programming. And this was creating for us not just a series of activities, but a system. So the system continuously gathers insight, builds relationships, and translates that into action. So now that we're in the final phase of the plan that you heard about in 2024, we're doing delivery. And this is the most action-focused phase of the project. This is where we're implementing programs, supporting the businesses directly, and we're translating insight into those tangible outcomes. This is the phase where the real value of the work is recognized. One of the clearest findings from the BRE survey work was a strong demand for practical, accessible business education. And this wasn't just anecdotal. We heard from businesses that delivering workshops and training was one of their key recommendations coming out of that research. They told us what they wanted to learn, when they wanted to learn it, and where they wanted to learn it. So what they explicitly told us, what they wanted more learning opportunities, particularly in areas like marketing, grant access, and emerging tools like AI. In fact, over 40% identified marketing support as a need, with strong interest in funding and digital adoption support as well. In response, we launched a monthly educational series that was designed to meet those needs in real time. Each session is built directly on what businesses told us they need and provides practical, expert-led support that they can apply immediately. These sessions are helping local businesses adapt to the rapid changes that are happening out there in technology, workforce expectations, and market conditions. This is a clear example of how we've translated business input into ongoing, tangible action. Relationship building is a core part of this work, and it's something that businesses told us that they need, specifically asking for more opportunities to connect, collaborate, and to share resources. In response, we've delivered a consistent calendar of networking opportunities, from our monthly business after business events to educational sessions that also create peer connection, and larger events like our Economic Outlook Breakfast that bring together business leaders, employers, and decision makers. In 2025 alone, this resulted in 38 events with over 1,400 attendees. Most of them were nearing capacity. But what's the economic value of connection? Connections aren't just social. They enable collaboration. They enable problem solving. They enable peer learning. And these are critical for business resilience. When we convene, we create
a key mechanism for strengthening relationships across the business community. We identify emerging issues and we support that collaboration in real time. But the work goes beyond convening. It includes direct workforce interventions that help address one of the most persistent barriers to business growth. So you can see here, we've accessed some of the high opportunity occupation lists that the province put out, and we partnered with Excel Career College to deliver relevant training and to get folks job ready. The next phase of the work, pretty excited about, is the launch of a regional economic data platform. Here is your first look. This is your sneak peek before this goes live on our website. This tool will provide real-time access to key economic and demographic data. It supports a regional view and also community-specific insights for Courtenay, Comox, and beyond. For businesses looking to invest here, this reduces uncertainty. This allows them to make informed decisions about where and how to locate. Click. Can someone else click me, please? There we go. While the BRE work has focused on direct business engagement, this platform here adds another layer. It gives us the ability to pair lived experience that we hear on the ground with data-driven insight. This platform, as I said, offers a regional view, and as well, it's also aggregated to your own communities, Courtenay, Comox, and Cumberland. Here's an example. Click. Next slide, please. There we go. Here's an example of how this can be used. A prospective restaurant owner can immediately see where similar businesses are clustered. So you can see on the top slide there, we've toggled the sector for restaurants. So that will show a heat map of where all the restaurants are located in our community. They can decide whether they want to locate within an existing hub or whether they want to establish in an underserved area. They can also toggle other switches that will help them know where young families are, where single professionals are, or where seniors are. So if you want to find out where seniors are, maybe you're a restaurant that caters to daytime traffic. If you are a restaurant that offers family dining, you'll want to know where those families are. And young professionals might be looking for cafes to work in or network in. So this demographic data helps refine the restaurant concept itself that will ensure the type of restaurant matches the local population. A prospective restaurateur can then move from asking, is this a good place to invest, to then saying this exact neighborhood will fit my concept. So my curiosity is, does this tool have the most impact on the Chamber's website, or is there a better place for it? Is there room for it on Engage Comox Valley? And can we follow up with staff on this? Because this work leads to so much interaction with businesses and nonprofits, we continue to hear about their needs, their goals, and their struggles as this project moves on. So this slide details some of the topics that are at the forefront. And what we're hearing is beyond just operational pressure. The current conditions are influencing whether businesses expand, whether they hire, or whether they invest. Over the past 2+ years, this work has built a strong foundation. It's created consistent engagement with the business community, identifying those key challenges and translating that into action. Well, a visible part of this work has been in programming and events. The broader outcome has been the development of a structured approach to engaging with and supporting the business community. What has changed, though, from the start of the project is the pace and the complexity of the environment that businesses are operating in. The pressures we're hearing today, rising costs, workforce constraints, those are directly influencing whether businesses grow, whether they invest, or in some cases now hold back. We started with a project, but the work is revealing itself as more of an ongoing function. because it's providing that real-time insight. It's providing targeted support and a direct connection between businesses and decision makers like yourself. The opportunity moving forward is to build on that foundation, ensuring that the insight remains current, that businesses continue to be supported in ways that are relevant and valuable to them, and that council has access to the information needed to make informed decisions. So the Chamber is well positioned to continue this work in partnership with the city, and we look forward to what we can build together. So over the continuation of 2026, we are continuing to build the resource page on our website. We're exploring mentor relationship building, and we are acting as a convener on current opportunities, for example, the defense spending in our community. So moving forward, I would like to invite Mayor and Council to join the Chamber on continued business walks, and that will help us engage with the business community one-on-one. And also I want to note an exciting event that we have coming up to kick off the warmer season, our 9 and Dine at the Comox Golf Club. No pressure, guys, but Comox Mayor and Council has already put together their golf team. Just saying. So I'm up for some questions if anyone's curious to hear more about the future of the project.
Excellent. Thanks very much. Maybe I'll start with one quick question, and it's sort of one that I've been talking about since being here the last 20 or so years, but it came up in the 90s and that boom, bust, and echo, and kind of like the actual like the retirement rate that we're looking at over the next 5 to 10 years. Because one of the issues that you brought up was that actual, like, how do you hire people and stuff like that? And so where do you see, or like through this, is that some of the data that's being shared with the businesses, or are they sharing it back, like in terms of that, like there's going to be, as far as we know, like a deficit with the amount of folks that are actually retiring, and how do you actually attack that as a business, so to speak?
Just to clarify your question, is it that there's going to be a lot of openings? Because
Yes.
folks are retiring?
Yes.
Yeah, so that's where the workforce support comes in. That's where the province has made the high opportunity occupations list, so we can toggle those switches and find out where the gaps are projected to be in our community. And we can target the training. We have partnered with Excel Career College, and there's opportunities to partner further with other organizations as well.
Excellent. Thanks. Mr. Garbutt.
Thank you. Through the mayor, just to piggyback on my colleague's commentary, we will also be bringing forward, there's a proposal that the town of Comox has done to do a labor force market study, and in coordination with the North Island College Learning Council, and council will receive that information, I think, at our next council meeting. Just for information, it will go part and parcel with this economic development initiative, and I think it's quite supportive.
All right. Thanks very much for that. And Councillor Jolicoeur.
Thanks, Mayor. And that was a really fascinating piece of information, because that's one of the questions that I had. And thanks, Tracy, for being here. I just actually have up, I think maybe for your final report, it would be helpful to kind of review how we all came to this and the project phases, and specifically some really good stuff that we had agreed to at the beginning of this service contract around the implementation components. And I'm just in that original document, and there was a few things that weren't explicitly stated in your presentation today that I'm wondering that you can speak to around phase 4, the implementation phase. And I remember at the time being really excited about the wellness events, which is a whole component per our city manager, workforce support, and the recruitment and awareness campaign. And I think each of those had their own separate line items in your proposed budget as well. And I think 10,000, 15,000, 15,000. So just wondering where we might be around the recruitment awareness campaign, the wellness events, and then the workforce support.
Yeah, the recruitment awareness campaign is what you see with the economic dashboard. So those funds were going to an external party to create that work for us. And then phase 4, the implementation, so I want to draw your attention to the expected components. So this document was created before we heard from the business community. And there wasn't a lot of, I was really excited about the wellness components too. Not to say that we're not going to be tackling that, but that wasn't listed as a large priority when we did the polling.
And the workforce support, specifically had here, I think just to our city manager's point, working with NIC and the Immigrant Welcome Center around newcomer support and strengthening connections with NIC, with the business community. Is that something that's planned or?
That is something that's planned.
Okay, thanks. Looking forward to seeing it.
Thanks, Councillor Jolicoeur and Councillor Hillian.
Thanks, Mayor, and thanks, Tracy. One of the issues that the business community identified when you canvassed them was workforce housing. I don't know how recent that was. We've had an awful lot of apartments go up in the last few years, including some with micro suites. Is there any indication that that building is filling the gap, or are you still hearing from people that their staff can't find places to live?
We're still hearing that housing is a struggle and the cost of living is a larger factor in that as well.
So it's not so much the availability of units, but the cost of them.
It's a complex issue and those are all big factors.
Sure. Okay, thanks.
Thanks, Councillor Hillian. I don't see any further questions or comments at this point. There is a motion if somebody would like to read that off. Councillor Hillian.
Thanks, Mayor. I'll move that council receive the 2026 business retention and expansion update from the Comox Valley Chamber of Commerce.
All right, it's been moved and seconded. All those in favor? Any opposed? And motion carries. And thanks very much for what the Chamber is doing, and definitely a critical organization in our community. And I hear great things from the business community. And I want to give a special shout out for the work that you put towards the McPhee corridor there with ICF, and just really acknowledge the efforts that you're putting in there. And yeah, looking forward. I'll see. I don't know if we have 4 golfers on council, but we can do the math and see what we can come up with.
No pressure, just saying.
Yeah.
So please don't hesitate to email or call me. Let's be in touch. Let's get out there. We'll hit the streets. We'll talk to some businesses. We'll see what's happening out there.
Fantastic. And I will make the offer right now because I don't golf, but I do volunteer for golf tournaments. So
Okay,
if you need
sounds
somebody
good.
to volunteer, I'm happy to do that. So staff? Oh, there we go.
Get your staff on.
Apparently
There we go.
someone's getting voluntold or but again, thank you very much, Tracy, and keep up the great work.
Thanks, everybody. Have a great night.
All right. Moving along, we have Operational Services Strategic Transportation Plan Progress Update. And so I'll pass it over to Matthew Brown or Mr. Garbutt.
Thank you, Mayor. As our staff and consultants get in place, this is extremely important work, growth management focused work that is important to address council's strategic priorities. We've been doing a heck of a good job working with entrepreneurs around housing development. We have more to do, but accommodating that growth when combined with the future of CFB Comox is some incredibly important work that we're going to be doing. So I'll turn it over to Matthew and Dan.
Is the clicker working yet?
It's not working.
It's not clicking.
Thank
All
you.
right.
Good evening, Mayor and Council. Matt Brown, I'm Transportation Services Manager for the City of Courtenay. Thank you for your time. Really excited and proud to be here presenting our strategic transportation plan. I'm joined by Dan Casey from Urban Systems, who we're partnering with. Just some background. There's a slide here that shows our journey to date. It even started before that for city staff. So back in January, February, when we first got appointed, when I first got appointed to the position, I noticed in the budget, we had a strategic transportation plan budget. And I was like, I quickly volunteered as it looks exciting. So it's kind of a unique time joining the city and seeing that go through the process. So, and what I really wanted to establish early on was something that met the objectives of the city and was very clear for everyone in the public to understand, and have some key performance indicators that, as we looked at different visions and ideas, there's lots of ideas about coordinating transportation that, as we went through the process, met all those objectives, and we could measure it as we implemented different solutions for the community. So that's a little bit of the background before we started on the journey of creation of the RFQ document and Urban Systems joining us. So once we established that, we put what's request for quotation out. We selected Urban Systems, which was great. We started what's called the preparing process from September to October, just launching communication. So lots of really, really good work from staff and the consultant went into this, and I want to acknowledge that. And I'm proud presenting that on behalf of them today. So once we did that, we started down the discovery process, understanding what's been done to date, past master plans, what worked, what didn't, understanding some traffic data and inventory. We presented a small report with that, which was great. Moving from there, we went to our visioning. So this is our first phase of community engagement. A lot of good work, some surveys went out. Dan's gonna touch on that in a bit. And that's kind of where we're at right now. The first 3 pieces of the strategic transportation plan have been completed. And it's a really strong foundation that we can build off. And now we're gonna move into the planning and moving forward piece, kind of leading right up till February 2027. And kind of within that period, that between that planning and moving forward, we're going to be doing further community engagement, which I'll highlight in the next slide. There we go, it's working, so that's good. So phase 1, as I touched on for the visioning, we went through community engagement, which included web and social media, online surveys. We did an open house. We had lots of conversation with partner agencies, including like MOTT, neighboring municipalities, for example, the airport as well. We had also interest holder workshops, including the Chamber of Commerce that was recently here. And then once we go into phase 2, the planning and kind of final report, we'll look at the engagement piece again. So with that, I'll hand over to Dan to speak to some of our community engagement.
Yep. Okay. Great. Thank you, Matt. And good evening, everyone. Nice to be here. So I'm going to talk through some of, I suppose we'll call it what we heard through the first phase of community engagement. So the numbers on the screen in front of us are participation rates, or the number of people who participated in the events that we've held. So I guess left to right, we had an open house at the very end of, I think it was January 30th. We had 65 people in attendance. It was sort of an event that spanned the bulk of a day, and a couple members of council and staff as well were in attendance. It was, we had 65 people attend. I suspect we might have had more, but we had a weather event and a state of emergency called for that particular day, which probably hurt our turnout just a little bit. But nonetheless, we had the folks that were in attendance, we had like really great conversations. We also had some interactivity around a series of scheduled presentations we made. So it was actually quite a great event. And the engagement summary document that's in the agenda package has a number of photos from that event in there as well. And you'll see people engaging in really great conversation. One of the other key items around the engagement was the survey. So the survey was live and available to the community over a period of just over a month. We had 316 survey responses, which we view as reasonably strong, which is great. And I'm gonna, in the next couple slides, share out on some of the, not all, but some of the key pieces from that survey that we were able to make sense of. We also had an interactive map that was available on a project webpage. We've had almost 400 contributions to that map, and that map continues to be available. And so this is a tool that allows people to actually pin specific comments to specific locations. And from that, we're able to make maps that suggest where people have greatest concerns or areas of opportunity. And so there are some maps summarizing that in the engagement summary as well. Mentioned, we've got a project webpage. We've had over 5,000 webpage hits to date, and that number is still continuing to climb as this project carries on. And then Matt mentioned we had a series of interest holder conversations as well that have been really great to be in small setting, and we get to hear sort of in a more like a one-on-one type situation through dialogue with some of these important interest holder organizations. So that's our level of participation. Now I want to share out just a little bit on some of the key takeaways from the engagement. And there's I think it's 50+ page summary document of this that's in the agenda package that really goes into more detail. So I'll touch on some of the key pieces and key takeaways. So the visuals that are on the screen in front of us were from the survey. We had a series of questions asking survey respondents to assign a value between 10 being quite positive, 1 being quite the opposite. And from that, across 4 key indicators. So the key indicators were overall level of satisfaction with the transportation network, network reliability, network safety, and network efficiency. And so the goal through this exercise is both to establish a baseline that give us understanding for the work we're carrying out now, but also provides KPIs, key performance indicators that can be tracked into the future. So we can start to see hopefully progress or at least change in terms of how community members view the network's performance across these indicators. So both an exercise in baseline for informing the plan we're carrying out right now, but also for continued monitoring into the future. And so what we're able to take from this in terms of baseline is we are seeing sort of the greatest level of support or the view most positively current network reliability, followed by safety, then efficiency, and actually overall satisfaction with the transportation network actually rated lowest among the four indicators. One other thing that was asked through the survey, again, across these same 4 indicators, but respondents were asked to rank each mode, each primary travel option for each of these indicators. And so the table that's on the screen in front of us, this is a summary of how each mode scored under each of the 4 indicators. And so a few key things we can take from this, probably most obviously was that we saw very low scoring among respondents for 3 of the 4 indicators at least. So for overall satisfaction, for reliability, and for efficiency. When asked specifically around public transit. So public transit scored lowest and in a couple of these indicators by a significant margin across 3 of the 4 indicators. So that really is a key takeaway, the sort of overall view of current public transit service. Another one was around the indicators specific to safety. Cycling scored significantly lower than any of the other 3 modes. So that's a real key takeaway from this exercise. We also asked some sort of supplementary questions around what are the greatest barriers to all modes, but cycling in particular. And we did hear that lack of protected infrastructure was a key one there as well as cycling adjacent high traffic volumes and high traffic speeds. So all painting a picture around this need to improve road safety specific to cycling. And another takeaway here was across all 4 indicators, we actually saw the ranking specific to driving to actually be highest or most favorable. And so perhaps an indication that the, there's work to be done across public transit, walking and cycling as compared to driving. We asked a question in the survey again around what should be the system priorities in the strategic transportation plan. And so the bar graph that's on the right-hand side of the screen here is a summary of that. And we heard fairly clearly that public transit, walking, and cycling should be priorities. And so again, another nod to the indicator feedback we received around the priority needing to be in support of sustainable travel options. So those are just a few of the key items that we can take away from the survey. We asked 30 odd questions, so there's a lot more that's in that summary document, and we provided summary of those questions in that document. I think thinking more fulsomely around the survey results, the conversations we had at the open house, and some of the stakeholder and interest holder conversations that were held as well. There's a number of sort of key themes or areas of focus that we take away from this engagement. And as we start to sort of round the corner into starting to craft the strategic transportation plan. So a few of the key things that we're taking forward. One was this concept around a major road network. And so what we are finding is that a lot of the delay and congestion that's incurred on streets within the city. There's a combination of streets that are serving local function, but also serving regional function. And some of that falls under jurisdiction of the province, of the Ministry of Transportation and Transit. And so the concept around identifying and sort of defining this major road network and then working with partners to realize improvements on those corridors. That's one item. We heard loud and clear a desire to see improved transit service. We hear through conversation and survey, this is both the service itself in terms of schedule, service levels, frequencies, as well as feedback around transit infrastructure and how can we support transit moving more effectively. Road safety was also a key piece of feedback we heard both through conversation and the survey. We did have a question in the survey around where to focus energy in terms of not mode specific, but plan outcomes. I think the number 2 priority was around enhancing road safety. So we've done some technical work to understand where our biggest areas of collision history are and where the sort of road safety hotspots are, and intend to bring that forward as part of this plan to make sure that we're focusing energy in locations where we can see safety enhancement. We heard strong support yet again for active transportation network upgrades, sort of both a nod toward pedestrian focused sidewalk infrastructure as well as to cycling network. And then I think lastly, a key theme that we've heard throughout is the desire to address locations of congestion and to decrease travel times for people engaging in all travel modes. So I think I'll hand it back to Matt to wrap us up.
Thank you, Dan. As I spoke to earlier, early on, we want to establish a process moving forward into the vision, past the visioning to the planning and moving forward phase, where we hear lots of ideas about transportation moving forward. And you heard with some of the KPIs we're going to be measuring those ideas against, but some of the key pillars and objectives that we, from that process that we heard is, number 1 is road safety for the community. Number 2 is congestion and delays. So making that better, the travel times or reducing travel times. And then finally is sustainable transportation. So a mode shift, improving transit, different options for cycling network plans. So those are our 3 key pillars that we're going to use to vet some of the plans or visions we see coming out of transportation into the future. So with that, that kind of finalizes our presentation. I want to thank you for your time and open for some questions.
Excellent. Thanks very much. I like the reduce the crashes and stuff, but also reduce travel time. So there seems to be potentially some conflict there between those 2 concepts, but really appreciate the work that you guys have put into this. And I'll pass it over to Councillor McCall.
Yeah, thank you. And thanks for the presentation and the work on this so far. I think the engagement process went really well in terms of both the open house and the online engagement and the interactive map. I had a number of people mention it to me and comment on liking the way that the information was asked for. I have 2 questions around that. One on the online engagement piece specifically. One is that there was no question that we obtained some great information around what people want and what the gaps are in terms of public transit, but it's also a service that the city doesn't deliver. It's a regional service. And I recognize when we go out to the public and we're talking about transportation, we don't want to say we're not going to talk about certain kinds of transportation, because I think it's lost on probably, more than 80% of people exactly, how different services are funded. So my question around that is, how are we going to use that information, both at the city level and, we've done a really robust engagement exercise. How is that going to feed back to our regional partners?
Yeah, I'm happy to have a go at that. I think specific to public transit, I think, is kind of the question.
Yeah.
And you're absolutely right. The city is a partner in the regional system, but by no means the only partner. And actually, the delivery is regionally and in collaboration with BC Transit. My hope is that this plan is a certain embodiment of the community's priorities and what the community would like to see. I don't see a harm in this document presenting where the community would like to see, sort of in a longer term sense, the public transit system going. Also, a key part of this plan will be actions and sort of identifying prioritization and potentially costing and responsibilities. That's where I think we need to be careful about. We can't commit a regional system to, these firm, strong actions with respect to transit the same way we could to sidewalk network upgrades or building a new bike lane or installing a traffic signal. So that's where I think the difference might come in. I think it's still very fair to embody where this community sees the transit system going, just falling short of making the same level of commitment on transit investment that we might be able to make in other infrastructure. That's my thoughts.
That actually probably helps answer part of my next question on this, which is, I noticed in looking at the engagement that there was hundreds of, well, maybe not hundreds, but many dozens of comments on the engagement specifically around the Island Corridor Foundation. And again, it's an opportunity where we're engaging with the community. I'm not sure if it's well understood by people that took the time to put their commentary there, that this is not really an avenue for influencing that. But I'm just wondering what we would do with that information if it's kind of some of that pulled out of maybe the data analysis, as it's not really a point of control, even at the regional level. We basically don't have say over that. So I'm wondering how we, and I mean, it's not new when you do an engagement. Sometimes you get a specific group of people that want to provide input on something that's maybe not completely what we're asking about. So I was curious about that as well.
And Mr. Garbutt's got a comment as well.
Yeah, thanks. Through the mayor to Councillor McCollum, this would also go to the first question about the utilization of transit information. We're operating in an integrated region where we have staff advisory committees. The information that comes out of these exercises is really valuable. Likewise, sharing that information with the Ministry of Transportation and Transit. So we will be passing that information on. We're also undertaking some joint work. There's related to the support of CFP Comox's expansion. There was a letter through the region to the Minister of Transportation, and I'm getting it backwards, Transit and Transportation, right? That's the right term. Calling on an integrated transportation plan from the gate of the base to our downtown Courtenay transit exchange. So these are important opportunities to share that information, and staff have both through our advisory committees as well as regularized engagement with staff. It's important, and I've asked our directors to share that information. We spend time and effort, and we have the public to give us information, and we can take it in and out of some of these buckets and inform that process would be important.
Okay, thanks. I'll get back in the queue.
All right. With that, we'll move on to Councillor Jolicoeur.
Yeah, thanks, Mayor. Thanks for the presentation. I just have to reiterate what the city manager just shared. The data in here is quite incredible in the sense of both what we heard, but also in terms of this was a community engagement process that was collecting information on our strategic transportation plan. But I actually see this informing dozens of plans at the city. I think specifically when we're talking about infrastructure, and we've just recently gone through a process around our DCCs and ACCs, and recently just had a developers meeting where they were talking to us about why is it that they have to pay for sidewalks. And we're hearing quite clearly here, the number one barrier for people to walk is they don't feel like they have the sidewalks end in the middle of nowhere, or the sidewalks don't exist in their neighborhoods. And so I do have a question, and the mayor kind of alluded to it in his initial comments as it relates to the complexity of how some of the data that we heard specifically around the priorities, and then the issues that people see around what is what are the issues that they're encountering around using a certain mode of transportation and how those might conflict with each other. And we see that in the priorities around road safety and then congestion slash getting to where you want to go faster. And I guess, you know, we've got you here as an expert in transportation. How do we see all of this kind of playing in together? And I think the piece that speaks clearly to me, whether it's the sidewalks or the biking infrastructure specifically, I do have comments around transit later, but a lot of this requires quite a significant amount of infrastructure investment. And so I'm wondering if you can speak to how you've seen other municipalities and how they've kind of mapped that out.
Yeah. Yeah, it's a good question, good comment. One of the strategies we've taken when undertaking similar plans in other communities, and we're sort of starting down that path here, is with kind of the 3 key pillars or objectives that we introduced: road safety, congestion delay, and sustainable transportation. Is go through a process of identifying priorities, so investments, not only in infrastructure, but regulatory policy, enforcement, et cetera, where we can demonstrate that they're providing benefit across more than one of those pillars, ideally all 3. And so we're not pitting necessarily road safety improvement against congestion relief improvement. Ideally, we're making investments, we're making changes that sort of check all 3 boxes. And so that's a process we're going to go through to make sure that the priorities that come forward are providing sort of the broadest benefit possible. I think your comment around the dollar value that's likely to be attached to some of these gap filling priorities, whether it's sidewalk network or bike network, I think is spot on. Some of these improvements can be quite expensive. I think our hope through this, though, is that I don't doubt there'll be some high ticket items that sort of come through as priority, but also we can identify priorities that sort of more strategically might happen concurrent with whether it's asset renewal or underground or other projects where the cost is not sort of fully borne and triggered by this transportation plan. It's something that's a bit more strategic and comprehensive. And so there will be a process of identifying priorities and then prioritizing those priorities to make sure that they're cost effective and they're sort of, we'll say, checking the box in terms of meeting at least more than one of the identified pillars or priorities.
Thanks. My second question, Mayor, and then I'll get back in line, was related to what we heard in the just going back in the what we heard report around driving and road use. And one of the comments that you put in here had a bridge and or tunnel as a river crossing. And I'm wondering, it's on page 17 of the What We Heard report under road key takeaways. There's an interest in new bridge or tunnel connections to relieve pressure on key corridors. I'm wondering if you could speak again as an expert in transportation around what you see as adding infrastructure like a bridge or a tunnel as a solution to relieving pressure. And I would infer, based on the priorities that we've seen, that would probably be likely related to congestion and the length of time that people are in their vehicles.
Yeah. I guess I've heard honestly less about a tunnel in my time in working in this community, but the concept of a bridge, a third bridge or another bridge crossing is something that's been part of conversation historically. And we even go back in some of the previous, I think, Matt, you'd scanned through a transportation plan, I think it was from 2002, where it had a whole bunch of alignment options and a bit of testing of options and things. So this is an item that has sort of been brought forward consistently over time as road network redundancy. So building in more opportunities to connect between east and west side of Courtenay, and potential to relieve congestion on some of the most major corridors. I think from my perspective, so it's something we heard through conversation. I will say I'm not sure through survey, sort of at a statistical level, or even through conversation, through engagements, we heard I wouldn't say we heard a terribly high level of support or interest for that concept this time around, but the conversations were had. I think from my perspective, if we were to apply costing to all of the potential infrastructure projects that could come through this, I think what we would find is that another street, not AT, but street or road network bridge crossing would it would be excessively high as compared to investments in active transportation, even street network improvements like a traffic signal, things like that. I think we'd find that that dollar value that would be attached to a bridge crossing would be 10, 20, 30 times that of some of the other network improvements that might be being contemplated. Okay. Thanks for that. And I do see Councillor Morin is online. We do have a couple more questions and then we'll get to Councillor Morin and I'll pass it over to Councillor Frisch.
Okay, thanks, Mayor. I have a question about sort of the rankings and the perception. I mean, I thought maybe there was a decimal issue with all, no, I'm just joking, because they were all 1s and 2s and it seemed kind of low. And I wondered, how the perception is like, what's it compared to? Like, are people thinking about how it was 20 years ago? Or are they thinking about how it was in the last community they lived in? And, it was spring break recently. I took 2 of my kids to work with me and I said, well, bring your bikes. And if you really don't like working, you can ride home. So maybe that's why they were so happy to ride from Comox all the way to Courtenay. And they felt they were safe. I was actually pretty confident that they would be okay. But then these numbers aren't how I would rate transportation, by bicycle or even by car. I mean, I find when I drive around, it seems quite efficient and not at all a problem at this point, though I know it could easily become a problem as we bring more and more people with more and more cars. But what do you think about the perception and the numbers that people are ranking?
I think so. The dial graphics that we showed is a nice kind of standardized way of presenting results, whether it's strategic transportation plan or other initiatives too. What I will say though is that it's a rating system out of 10. And so when we see the green portion of the dial, that represents responses that were either a 9 or a 10 out of 10, positive. The yellow represented a 7 or an 8, neutral it's called. And then the red, which frankly looks relatively alarming when we put it off the screen like this, that represents a response between 1 and 6, referred to as negative. So, there's a fair bit that's taken in that negative slice of that pie or that dial. And so kind of worth reminding, I guess, the method that's behind it. To the question around, does it represent experiences relative to other communities or relative to past? Honestly, it just depends who put the time into filling out the survey. I'm not totally surprised to see things like reliability for transit to be rated low. I'm not surprised to hear that cycling safety is a high concern, that sort of thing. I was sort of mildly surprised to see how positively traffic and street network and driving is sort of viewed. Because, we still do engage in conversations around being stuck in traffic on 17th Street Bridge or Ryan Road or something too. So it was mildly, I guess, surprised to hear that feedback.
Yeah, well, thanks for your thoughts on that. I guess it does make sense to just look at them relative to each other instead of on a numerical point. Red, a high end of red actually might mean someone's rather satisfied, I guess. Okay, well, thanks very much.
Thanks, Councillor Frisch and Councillor McCollum.
I think Councillor Morin had her hand up.
Your light was on, then she put her hand
Oh,
up.
okay.
Yep. But I did
Right, just
let her,
making sure.
I think you were out when I told her that she's next.
Oh,
after you,
okay,
so.
all right, thanks. Yeah, where was I? Yeah, so in relation to, who we've engaged with and the type of information we get back, and that initial slide around overall satisfaction and reliability, that the challenge of asking people about the overall network when there's different things layered in there, like the transit, it to me is a completely different issue, and it is a important issue. And we've had a lot of challenges around reliability of transit, but I don't know if that is as pertinent to the plan and the strategy that we're trying to get out of this process. So I think that was part of why I was bringing up the transit challenges, that when we're asking people about transit versus how reliable is it to ride your bike or drive your car is a little bit different, because there's another service that's not just infrastructure involved there. But my question and comments, I guess, is it was really interesting to see some of the collision data for various intersections around town, and also seeing it split out by active transportation versus vehicle, because that's also surprisingly, there's not actually that much overlap, although there are some. I was really surprised to see that we haven't had any active transportation accidents on Fitzgerald, because it is not the best design once you leave downtown, and it's really wide, and we've only just recently improved the crossings in terms of pedestrian visibility. So that surprised me in a good way. The other thing that surprised me is that 2 of the intersections that we've had a number of accidents is along 6th Street, which is, of course, going to be an even more important corridor going forward once our active transportation bridge opens. And I guess my question is, you know, when we're looking at this data and there's vulnerable road users is really what I think of when we're talking about active transportation. Is are we looking to prioritize safety improvements in those areas in a different way than, I mean, with vehicles? A lot of the vehicle intersections are actually labeled as controlled by the province over the city. And so I'm just interested to hear how we're going to use this data to inform priorities, because of course, like, it's one thing to hear about what people would like to see, but then the cost of improvements is really a bigger challenge, and that kind of doesn't necessarily come in through the engagement process. So I'm just wanting to hear what the thoughts are on that.
What I can say to that is the number one priority heard from the community was road safety. So we haven't, for our 3 pillars, we haven't established a kind of a weighting category, but hearing your comments around that, we'll reflect on that and make sure we make sure we weight that appropriately when we're doing our improvements. So that's what I can say to that.
I'd add, if I could, too, on the data is an important input, but not the only input. I think we put like the appropriate disclaimers in that phase 1 summary document, but the work that's been done there is based on ICBC claims data. No claim, you know, no dot on the map. And so we know that pedestrian and bike related crashes are underrepresented in the claims data. So there's that disclaimer. So we also ask through survey for people to pin pins to the map with their areas of safety concern. And they do actually, from what I recall, tell a similar story, but they are definitely 2 sort of sources of input. And then I think the other thing that is specific to road safety is one of the things that wasn't done in that map is just raw crash data locations. When there's a more in-depth sort of road safety focused analysis that's done in certain places, I've done them in some places, there's a factoring for exposure rate. And so, of course, there's lots of crashes at Cliff and 17th. There's tens of thousands of vehicles that go through there a day. But when you can factor for how much traffic volume travels through a location, and then you start to see where these less busy locations have still a high rate of collision occurrence, that's an indication there's like a real underlying safety concern there, and often an area we want to focus intervention.
Yeah, that makes sense. The other comment I just wanted to make on those data tables is that the one intersection, maybe there's another one, but the highest collision intersection that's at least partially in the city control is Lerwick and Ryan. And it was on the pedestrian list and the vehicle list. And as far as I can tell, that's the only intersection in town that has a 60 km/h speed limit in both directions. So, I mean, it does seem like for at least we control one direction. I don't know why we have a 60 km/h zone in front of, the college, our highest incident intersection, and the hospital. To me, the speed limit along there is too high. And that seems like something that we could probably work with the ministry on, because it cannot be that complicated to reduce that, especially given that the data is there and widely available. Thanks.
Thanks very much, Councillor McCollum and Councillor Moran online, and we have Councillor Hamilton online, and then we just have Councillor Zolliker here. So, Councillor Moran.
Great, thank you. And yeah, thanks for the presentation. I found the report really interesting. And I really enjoyed reading about the demographics actually, and also I mean, most of us know this, that our population grew more, much more than the provincial average. But I was just in Victoria. I hadn't been to Victoria for a while, and it took me well over an hour to go 15 kilometers to get out of town. And so I think if most of us who live in Courtenay spent a couple days in Victoria, we'd be quite appreciative of the, 3 or 4 minutes it takes to get across the bridge. What was interesting in the demographics I found was we definitely have an aging population for sure, a little bit above the provincial average, and that 85 plus is going to grow by 181% in the next 20 years. But parallel to that really is the 25 to 44 age group and youth. And the other demographic that stuck out for me was around, a couple of them, newcomers and low-income households. And Courtenay has more low-income households than surrounding areas. And so all of that combined, to me, spoke around equity. And I haven't even talked about accessibility yet, which was mentioned in the report. But we definitely hear a lot from citizens around barriers to accessibility. But I know that we are going to see more families struggling. We already know they're struggling with housing costs, and probably if they haven't already moved to one vehicle, one person walks to work or whatever, the other person has the car. So I guess this is kind of going back to Councillor McCollum's point around priorities. I guess I'm always of the belief that we should be trying to reduce the barriers for the folks that are the most barriered, and also that we focus our efforts in that area, and the people who have more means are going to be more likely to use different modes of transportation, I guess, other than active transportation. I mean, that's an assumption, not entirely true. However, I know that low-income folks are walking, are cycling, and definitely youth are not always being driven by parents. So I'm just wondering if you can speak to those sort of demographic trends and how this kind of informs the approach going forward, as well as really looking at that equity piece, which I think is super important.
Mr. Shaw.
Thank you, Mr. Mayor. Through yourself to Councillor Moran. Great. Thank you for the question. Just holistically, maybe if I just take a step back just around data acquisition in terms of the survey, just really, it's been a great survey. It's been a great process. The inclusivity of the data sets that we've collected have been very informative, as council has articulated. And I think one of the goals on the forefront of this process was to not create a biased platform for individuals. We wanted to collect data that was fulsome in its receipt of feedback from the community relative to any service provision within the community that they may be receiving, whether that be transit or road, and then unbiased in terms of authority over that road. If we really are looking forward we're looking for to forecast through our planning phase solutions that will holistically solve a multitude of factors, including all the three of our pillars. We want to know that those can overlap and that those can be consumed collectively, not just individually within one jurisdictional area. Transit is a good example. We would look to understand if our road networks as a city are a barrier to increased transit efficiency, being priority intersections or priority lanes. And so that's why that information, although it very pointed to some of the services that are provided by the CBRD, are very, very important to us as a city, as the purveyor of transportation networks and road infrastructure. So there's that. In terms of equitability, as we talk through the process and we understand what the solutions or potential solutions to that may come forward as both large-scale capital, small capital, or ongoing renewals within our community, those priority metrics will not be defined based on the information that we receive in terms of feedback from the community through this process, as well as council priorities. If council sets forth priorities that inclusionary items such as access to all ages and abilities to transport, all alternate mode transportation, as well as transit, and then accessibility are the top three priorities, the focus of the project delivery from a capital onset would be focused and driven on that. So I really see, not to generally forecast the outcome of this, but the reality is that's a piece that council has to offer in terms of guidance to staff as we deliver on those. We can build you a list of projects. We can build you a list of projects that overlap and build you a list of projects that meet all three of the pillars. It's really what council's vision is for the community in terms of what they want to represent for those to be the priority projects for that term.
Great, thank you.
Excellent. Thanks, Councillor Warren and Councillor Cole Hamilton.
Yeah, thanks very much, Mayor, and thanks so much for the report. I guess the sort of results regarding people's feelings of safety were quite striking, and I was wondering if phase two of the next step in the reports is going to look at perhaps a performance audit on the existing community bikeways to see if they're actually meeting the Pillar 1 safety standards, given people's anyway. If we're going to look at those existing pieces and see if they are functioning to that level.
I think, if that's a direction that we'd like to be taking, I think we're very open to it. I think, most typically the emphasis, especially, most North American communities have, incomplete cycling networks. The emphasis is often on filling gaps and expanding a network, but also no harm in reevaluating some of the facilities that are already in place.
May I ask a brief follow-up?
I think Matt was just going to add a little
sure.
comment.
Yeah, just around the cycling safety 2 element, we are piloting some of the measures that we take away from the survey was that people want to see separated bike barriers, and we are doing a pilot in certain locations to complement that. So we are taking steps to mitigate some of the safety concerns people do have. So I just want to add to that. Thank you.
Okay, and if I might ask a follow-up, I was just going to ask if you think it would be, given what you've seen in the report, probably to Dan, if you think it would be advisable to do an audit of sorts of the existing infrastructure to in light of these new findings.
Yeah, I guess my own personal thought on that is there's so much work still to be done in terms of building out the network that I would lean toward let's fill those gaps and make a complete network. I would say I've done these sorts of plans in other communities as well. You have built some pretty great cycling corridors here. Like if we go up and down the island outside of some of the biggest municipalities on the island, you've done quite a nice job here. And so, of course, you can always do better, and better often costs more. But I would tend to lean toward completing a network, filling those gaps before sort of going back and reevaluating what's already been built.
Okay, given your experience, that's helpful guidance. Okay, thank you.
All right, thanks, Councillor Cole Hamilton and Councillor Jolicoeur.
Yeah, thanks, Mayor. Councillor Cole Hamilton went with my set of questions, and I was remarkable that the number one thing that would make people get on bikes was protected bike lanes. And so I'm glad that we've spent some time talking about that, and I'm happy to hear that we're going to be piloting some of that, because I think we only have one corridor, maybe two corridors.
Two as of today. So 17th is just added today. So our team
Great.
is on that. So,
Okay.
yeah.
Moving over to transit, and this was a question that maybe for our city manager. I do find the data that we've collected quite informative around transit. I agree with Councillor McCollum that transit, I think, should be looked at potentially as a separate conversation as well. And so I'm wondering, this report, the staff report, the transportation plan progress update, and what we heard, is it safe to say that this will be referred to the CVRD TAC on transportation, just so that the transit service can understand the really good feedback we got that this was the key mode of transportation that had major issues in the community?
Yeah, thank you, Mr. Shaw, through the mayor to Councillor Jolicoeur. Mr. Shaw sits on the Transit Management Advisory Committee. And so absolutely we'll share that information. And then I would remind council that there are regular updates to the board about the transit system and its performance. And if council has some questions around data or anything like that that they want to refer, we could do that either through staff or your colleagues that are directors on the board, because it's really important to share the performance of our transit system. And as a former employee of the CVRD who had responsibility for that transit function, it's a very high functioning transit system. And our land development, our form linear service corridors is really quite effective. So I think it's a good news story. It provides transportation for all members of our community, from young to old, abled, and people who have mobility challenges. So I think it's really important to get that message out, and the positive message that's contained within this data, I think, could assist.
Yeah, thanks. And just as a quick follow-up on transit, maybe for Dan, again, for your experience in transit, what was in the report, the progress report? You highlighted the end of trips. I forget the terminology, but and one of the key things beyond bike storage is also shelters for folks. And so I'm just wondering, in your experience, because there wasn't a lot of data that spoke to how much that actually impacts individuals' decisions for mode shift. And I'm having a hard time reading, and it does highlight we're doing pretty poorly with that. I think 22% of Courtenay's bus stops have shelters in the report. And so, yeah, just wondering ROI on that for mode shift for transit.
Yeah, that's a really good question. I honestly don't know. I don't have a firm answer to that in terms of, level of investment relative in shelters or bus stops and payback, we'll say, in terms of increased ridership. What I can say is, we've talked a little bit about transit service and the city being a partner within a regional system. Municipalities tend to have greater influence over the infrastructure that's provided in the transit system, and bus stops and transit shelters might be one of those. There is also partnership opportunity with BC Transit in the province around providing some of that infrastructure. So probably a lot of opportunity there. I think maybe it's, on us as a next step to an extent to figure out, if we made those investments, what might the benefit be in terms of more people using the bus? And Mr. Shaw.
Yeah, thank you, Mr. Mayor. To Councilor Jolicoeur, just on the transit shelter piece, within our service parameters around transit shelters are the provision of the city within the city's network to provide in terms of cost. So we do have a partnership with Pattison to provide shelters. We have asked the CVRD for statistics with respect to usage per stop to understand which ones would be high ranking relative to need. So what investments could be prioritized based on those. And so we have done a very high level review of that, and we'll look forward to bringing forward some capital items with respect to that and working with our partners in Pattison. They do prefer high corridors because they do a net benefit in terms of the promotional opportunities or advertisement opportunities that they have within those shelters. So they don't always say yes to the ones that we request. The other part of it is our network is quite robust in terms of our community, and there's a lot of residential interfaces. So while we do have a large number of stops, many of those stops are in people's front yards on a residential road network, whether that be a collector or so on. And so the opportunity to erect a transit shelter in that particular location may not be prudent in terms of an opportunity for the city. And so sometimes that's why the numbers skew out a little bit lower. But we do try to prioritize corridors that are high use, high function, minor and both major arterials throughout our community.
Thanks so much for that. And Councillor Hillian.
Thanks, Mayor. I just wanted to reflect a bit on Dan's comment about the fact that our cycling network has improved significantly and is in pretty decent shape compared to other municipalities. I think reports like this tend to highlight the deficits that we have because we're looking at where could things be better? And let's face it, things could always be better. In the time I've lived here, when I first moved here, it took you about an hour to get through town on a Friday night across the one bridge. There were no bike lanes and there were no buses. So, what I wanted to actually suggest is that we'll have an annual report coming out shortly, and I hope that it will highlight what actually has been accomplished in the area of traffic safety, given the prevalence of that concern. The number of places that we've put in, pedestrian activated flashing lights to get across roadways, which make a huge difference to the neighborhoods that they're in. And the various other traffic calming up in the Lake Trail area and other places like that, so that people can actually see where things are in fact improving. Thanks.
Thanks so much, Councillor Hillian. And I would say, yeah, the general feedback I get for, reducing speeds to 40 kilometers an hour in residential zones. I mean, most people that I talk to about traffic actually is around the areas where it isn't 40 kilometers and where that conflict happens. And so, yeah, I'm definitely really impressed with the progress the city's made over a number of years. So I don't see any further questions or comments. So there is a motion, Councillor Hillian.
Yeah, I'll move that council endorse this progress update of the strategic transportation plan and direct staff to continue to advance to planning phase.
Right, it's moved in second. All those in favor? Any opposed? And motion carries. And I would suggest at this point, because that was about an hour as well on that item, that we break for dinner and we come back at coming up with the time 6:50. I'm going to say 6:45. We're gonna work for 6:45. Let's see how it goes. Thanks, everybody. all fired up, ready to go.
I'm just gonna see staff. For questions on my social media.
Sounds great. Okay, everybody, thanks for standing by while we had our dinner break. We're back now at 6:45 as promised, and we have on to item 6.2.1, the encroachment agreement for Coastal Community Credit Union. And I'll pass it over to Mr. Garbutt.
Thank you. Through the mayor to council, we have our staff report on this encroachment request. And we have a recommendation that's council authorizing encroachment agreement associated with the laneway adjacent to the following lots at 280 3rd Street, 268 3rd Street, 291 4th Street, and that staff proceed with statutory notice requirements in accordance with the applicable sections of the community charter, and that the city manager be authorized to execute all documentation related to the agreements. Staff are available if council has any questions.
The recommendation. Second.
Okay, recommendation's been moved and seconded. Looking online to councillors McCollum and Cole Hamilton to make sure everybody's good there. Oh, sorry. As that close, I didn't have a name in front of me, so I was filling it with my own mind, obviously. Councillor Morin or Councillor Cole Hamilton. Seeing no questions or comments, I'll call the question. All those in favor? Any opposed? And motion carries. And on to item 6.3.1, letters of support request from the Comox Valley Pride Society. I'm going to stretch my talking just for a moment or two and pass things over to, this is what happens when we're on time tonight. So thank you, Ms. Saunders, and I'll let you introduce Connor.
Thank you. Thank you for your patience. Through the mayor to council, the report's going to be introduced by Connor Tice, our new special events and culture coordinator with the city, who joined us just 2 months ago.
Hello. Nice to see you. Thank you for having me. My name is Connor Tice, and as Susie mentioned, I'm the culture and events coordinator.
You may want to just bring the microphone a smidgen closer.
Better? Okay. Sorry, I am a quiet talker. I will do my best. So the purpose of this report is to seek council endorsement for the Comox Valley Pride's grant application to the Festivals Building Communities Through Arts and Heritage grant, and to confirm that the city's continued in-kind support of Pride Week. The report further recommends that council authorize a multi-year continuation of existing levels of in-kind support for Pride Week until the forthcoming special events and hosting policy is developed as part of our cultural strategic plan and implementation strategy. That policy work is planned to begin next year. Pride Week is a key annual event in Courtenay, celebrating diversity and inclusion for 2SLGBTQIA+ communities and allies. The city has a history of supporting community-led cultural events through in-kind contributions. Comox Valley Pride received this grant in 2025 for Pride Week and is excited to be applying again. And they have identified that the city's support is critical for their application and their event delivery. This year's program builds on previous offerings to include a heritage component such as Indigenous queer art exhibition, allyship workshop, and queer senior pride celebrations. It will include performance components, including Pride in the Park with local drag performances, storytellers and choirs, and an arts components, including vendor booths for 2SLGBTQIA+ artists, art workshops led by members of the 2SLGBTQIA+ disability community. So all of these activities aim to foster inclusivity, accessibility, and community engagement. Supporting Pride Week aligns with the city's cultural strategic plan, particularly our goals related to community resilience, inclusion, accessible cultural spaces, and capacity building for community-led arts organizations. The city's in-kind support for Pride Week is valued at up to $10,000, covering garbage collection, traffic control, including the 5th Street Bridge closure, barricade setup and takedown, and administrative support. Multiple city departments will coordinate logistics, permitting, and communications. And I have to apologize that the support form that was included in the report was an older version. It did not accurately reflect the $10,000 request. In conclusion, endorsing and supporting Pride Week programming demonstrates the city's commitment to diversity, inclusion, and cultural vibrancy. Authorizing staff to provide letters of support valued up to $10,000 for Pride Week related grant applications streamlines administrative processes for both the city and for community organizers. Thank you for your time and consideration, and I'm happy to answer any questions.
All right, thanks for that. It's been moved and seconded. Are there any questions or comments? Councillor Frisch.
Yeah, and I might have missed it, but is most of this happening downtown and in the parks near downtown for Pride Week?
Mayor, yes.
Okay, thanks.
And you can leave your microphone on because there'll be more questions. Councillor Cullen.
Yeah, just clarity on the in-kind support valued at 10,000. Is that in-kind support actions that can be absorbed within our existing operations, or next year is that going to be added onto operations if we do this on an ongoing basis? Or because usually when we have a request for funding, although it's in kind here, we would see what the source of funding is. So I just wanted to be clear on that.
Can I, sorry, through the mayor, can I direct that question over to Kyle?
Mr. Shaw.
Thank you, through the mayor. Thank you, through the mayor's Councillor McCollum. So the short answer is yes. Typically, we'd look at the operational budgets to see if there's monies to support. As we know, costs with respect to traffic control operations are exceedingly high, especially when we talk about parades and the operational staff that are required to support it. So in this case, it would be recommended in terms of support this year, the budget for DCBIA events or events within the downtown core is pretty well at its limit. And if this is something the city wants to support in perpetuity, we would suggest that it hit the operational budget in terms of next year for contribution on an ongoing basis. And we could eliminate this type of ongoing request and just continue on a per annual basis.
Okay, that makes sense to me. I'm comfortable with option one. Thanks.
Right. See no further questions or comments. I'll call the question. All those in favor? Any opposed? And motion carries. Thanks, Connor. Moving along, we have Island Coastal Economic Trust letter of request of support for legislative modernization and provincial investment. Okay. Yeah. Oh, no, I was just waiting for Connor's mic to go off, and Councillor.
And I'll move that council provide a letter of support to the Minister of Jobs and Economic Growth advocating for legislative modernization of the Island Coastal Economic Trust and associated provincial investment to enable long-term inclusive economic development across Vancouver Island and coastal communities. And a copy of the letter be forwarded to MP Gordon Johns, MP Aaron Gunn, and MLA Brendan Day.
Right, it's been moved and seconded. And as some of you may know, the city of Courtenay has brought forward motions in the past to UBCM and supported the Island Coastal Economic Trust. And we've been the benefactor of projects, especially not just in Courtenay, but in the Valley, which have been great. And so, yeah, we're just looking for that economic stability. Seeing no questions or comments, though, all those in favor? Any opposed? And motion carries. All right. Next, we have Strathcona, Comox Strathcona Hospital District Board Long-Term Care Project request for letter advocating resumption of a facility. And this came in from Councillor Hillian. Councillor Hillian.
Thanks, Mayor. You will know that I chair the hospital board for Comox Strathcona, and one of the strategic objectives that our hospital board has been working on for a number of years in coordination with Island Health has been a long-term care hospital in Campbell River, which would be a regional facility, which is badly needed. The North Island has more seniors and longer waiting lists proportionally than other parts of the region. And the province announced this project in the summer of 2023 with the Premier and the then Minister of Health making the announcement in Campbell River. It's the only project on Vancouver Island, the only long-term care project that has in fact been paused as a result of the provincial budget. And it's one of 7 across the province, coincidentally all in opposition ridings. And I think that a letter of support from the city of Courtenay and the hospital board's efforts to get this project back on track will help the province perhaps to see that there is regional support and that this is not a partisan issue of any sort. I have had opportunities to speak as recently as yesterday with the Minister of Infrastructure. And I think there's room to move for the government on this. And if we can add our voices, I'm hoping that that would help. And so I do have a proposed resolution to move if it's appropriate to do that now.
Yep.
Whereas the Comox Strathcona Hospital District Board has been working with Island Health for many years to have a long-term care hospital built in Campbell River to address the critical need for such services in the North Island region, and whereas the provincial government's region budget has put this project on hold, therefore be it resolved that Courtenay Council write to the Premier in support of the Hospital District Board's request for a meeting to advocate for the resumption of this much-needed facility.
It's been moved and seconded. Any questions or comments? Seeing none, all those in favor? Any opposed? And motion carries. Moving on to the East Courtenay Fire Hall project update. I'll pass it over to Mr. Pitcher.
Thank you, Mayor. Good afternoon, Mayor and Council. I'm here to provide a brief update on the East Courtenay Fire Hall project. This project has been a long-standing priority for the city, driven by growth on the east side of Courtenay and the need to maintain reliable emergency response times. We've made solid progress over the past year. The design is now well advanced and the project remains on schedule for a summer 2026 construction start. Our current cost estimates show we're on track within our approved budget. The facility itself is designed to be practical, durable, and fit for purpose while also meeting current energy and accessibility standards. It will support our firefighters with the space and equipment they need and help ensure we can provide a high level of service to the growing community. Overall, this is a well-developed project that reflects Council's direction and positions the city for the future. We have Jason Unger, architect from Sahuri and Associates Architecture, who is leading the design to take us through an overview of the design. After that, we're here for any questions. Thanks.
Hello, everyone. Thank you for having me here today to walk you through the current design for the East Courtenay Fire Hall. If you go to the next slide, or am I able to control it? Thank you. So just a quick overview of the project location. So on the left-hand side here, is it still being shared? Just want to make sure.
Oh, we're just adjusting the volume. Your volume is just a little bit high. It's not your fault. We're just we cranked it up at the beginning of the meeting here, but
okay.
Yeah. Do you want to just do another voice or sound check?
Yeah. Can you hear me better now?
I think it's perfect. Thank you.
Okay. If you just want to go back one slide, please. Thank you. Okay, so yeah, just to give an overview of the location for everyone. So on the left-hand side, there is a greater area map of Courtenay and Comox. The number 1 in the lower left-hand corner is the existing Courtenay Fire Hall. The number 2 is the location of the new fire hall, and 3 is the Comox Valley Airport, just for reference of the location. So it falls halfway in between those two primary areas. On the right-hand side, you see a kind of zoomed in version of where the fire hall is going to go. So that's the blue box on the left. So the number 1 is the new fire hall location. The number 2 is the existing training yard for the fire department, which has various apparatus and existing buildings for training. And number 3 is a North Island Hospital across the street. If you go to the next slide, please. As Adam said, this is a purpose-built facility for Courtenay Fire Department. It'll support the growing demands and needs of the Courtenay area. It'll be an efficient layout enabling rapid emergency response and use within the building. It will also support the training that already goes on the site, both having a interior training room in this building, then directly supporting the outdoor training that happens in the yard. The design is durable and has a strong civic presence. You want to be proud of this building in Courtenay as it serves the public. And then a important thing to note is that it's an all-electric building that's committed to long-term environmental sustainability. If you can go to the next slide. So this is a site plan. This has been rotated slightly from true north. So north is on a diagonal, kind of up and to the left. So just highlighting some of the areas on the site. So number 1 in the lower left-hand corner is the existing site entrance. Number 2 in the middle is the fire hall itself. Number 3 on the left is public parking. So it's the first thing if the public is coming here or other departments or people are coming for training or events, they can enter the parking area right away. Number 4 in the top left is a garbage recycling and a generator that the building is connected to because it's a post-disaster building. Number 5 is a secondary gated access that leads into the Costco parking lot. Number 6 is staff parking, plenty of staff parking on the site here, again, to support the training that goes on. And then number 7 is the existing training yard that is not within the current scope of this project as it's already built. Go to the next slide. Just running you through the layout of the building. So this is looking at the main floor. Typically, the way that fire halls are designed, we work very closely with the local municipality, especially the fire chief and the entire fire department. Normally, there are 2 distinct zones in a fire hall. So there's what we call the clean side of the building, which is typically the office and administration side, and then the dirty side of the building that has the apparatus bay and a lot of support areas that support the function of the fire hall and specific operations. So I'll just highlight a few of those here. So number 1 in the lower left-hand corner is the public entrance. That's what you would see when you first enter the site. Number 2 is the office space. So there's 3 enclosed offices and then another open office and reception area at the front. Number 3 is the training room. So that seats about 40 people for various training events. It can be oriented in 2 different directions and has a kitchenette in there to support various functions. Number 4 is the staff entrance, and there's actually 2 of them. So one at the top of the page and one to the right, depending on where staff are responding to the building or entering the building. Number 5 is an elevator for accessibility to the 2nd floor. So the building is universally accessible throughout. Number 6 in the middle is the gear lockers. There are many spaces in the core there. So you can see at the top of the page, there's grid lines. So in between 4 and 5 is kind of the division between the clean space on the left and the dirty space on the right. But 6 is one of the primary things because that is where the firefighters' gear is stored. And as this facility kind of grows, initially it's going to be have few permanent staff and more people are going to be volunteers. So they're going to be responding through the staff entry, get their gear in the gear room, and then go into the apparatus bay, which is number 7. They will board whatever vehicle or apparatus is required to respond to the emergency and then leave from there. As the building has more permanent staff, typically we see this gear room in the center of the building as it's shown here, because people will be in the training room or the office and they will respond through the gear room, get changed, and then go into the apparatus bay and again exit the facility. If you can go to the next page. This is a view of the 2nd floor, so directly above all of the spaces we were just looking at. So again, starting in the lower left-hand corner, there are 4 dorm rooms, so that will support permanent staff for 24/7 response and staffing of the building. Above that, number 2, there are lockers and a laundry area. So that is for uniforms or just general, clothing that might change from their street clothing into their uniforms. Number 3, above that is a kitchen and day room. So there's a large kitchen area to support meals and the staff living there and staffing this throughout the day. And the day room is kind of a relaxation area where they can sit adjacent to the kitchen. And just above that, there's an outdoor patio space. Number 5, again, is just highlighting the elevator. Number 4, below that is a fitness room. So that'll have gym equipment to keep the firefighters fit. Number 6 is a storage mezzanine. So this is accessible from both the apparatus bay, which is number 7 here. There's a sliding gate that opens from there. So if there was a forklift here, they could bring larger equipment or larger stuff to store up onto the mezzanine. There will also be a hoist beam. So it means that just a simple chain hoist, you can lift larger things up there. But the design of this also allows people to access that storage mezzanine from the fire stairs. So at the top and bottom of the page there, you can see the stairs. So those are both for fire safety from the second floor and also access from the second floor to the office space and the second floor into the apparatus bay. So the mezzanine can also be accessed via those stairs. Next slide. And then these are just looking at some exterior renders of the building. So this is the public entrance on the south side. So, having a strong civic presence, clearly this is the main entrance, welcoming people depending on what they are there for an emergency. Looking at some of the exterior finishes, it's all kind of metal clad with various textures, but very durable, low maintenance materials. If you go to the next slide. This is the north side of the building. So right in front of you in the middle of the page on the second floor is the patio space that is off of the kitchen and day room for the firefighters. Below that, the 2 black doors that you see are the entry to the mechanical and electrical rooms. So those are easy to access in terms of maintenance or if and when future renovations or upgrades need to occur. If you go to the next slide, this is a similar view of the north facade. You can see one of the employee entrances there, highlighted by the wood grain metal material that will be there. Lots of windows, allowing natural light into the spaces. There's a tall window there in the middle that's in the staircase. And then on the left-hand side, the overhead doors to the apparatus bays. And if you go to the next slide, this is circling back to the front of the building. Again, looking at the 2 overhead doors on the other end, because these are tandem bays, meaning 2 vehicles are parked in tandem. They can drive straight through the bays. However, in discussion with the Courtenay Fire Chief, the way they will operate this is the vehicles will actually be backed up against each other. So you'll have 4 vehicles that are always ready to respond, 2 out of the south and 2 out of the north. And then going to the last slide. Just some overview pictures or renders of the fire hall from all 4 corners. Just highlighting again some of the public parking spaces in the top left. You can see the garbage or enclosed garbage area and the generator in the image in the top right. And then the 2 images on the bottom. Something to highlight there is kind of the large gray floor area that is in between the actual building and the parking stalls. That is an area that's being reserved for a future apparatus bay to allow for future expansion. So there would be 6 vehicle parking spots or 3 tandem bays in the future. And that is a quick overview. So if anyone has any questions or comments, please let us know.
Excellent. Thanks so much for that. I'm going to pass it back over to Adam, I think.
Yeah, thanks for the presentation, Jason. Yeah, so we're here to answer any questions you have. Thanks.
Excellent. Councillor McCollum.
Yeah, thank you. And thanks for the presentation. It's great to have an update on this project. It looks like it's coming along really well. I just had a question around process. I don't think it was until more recently that I'd heard the term construction management model in terms of how this is rolling out. And I don't think that that model has been explained to council about, yeah, because it's not the same approach that we've done with other capital projects. So just wanted to understand really what that means. And from reading the briefing note, it doesn't sound like we've gone out to construction tender yet. So just wanting to understand, you know, how those pieces fit together around design and the construction management contract and what comes next.
Absolutely. Through the mayor to Councillor McCollum, and Jason, I'll ask you to help me out if I miss anything here, but you're right. Construction management, this is the first time we're using this project, but understand that it's widely used in a lot of vertical infrastructure, fire halls, schools, things like that. And so some of the major benefits of it that we see so far is we have the contractor, Kinetic Construction. They're involved in the design process with us now, working closely with Jason, the architecture team, and all the subs as well. So they're working through reviewing designs, talking about constructability during construction. So a major benefit is that when Kinetic begins the work, they're already well aware of the project. They've reviewed it. They've had the input and say into its design, which is a really really beneficial thing. I think typically we do a design bid build where its project is designed in one phase and then goes out to industry, and builders or contractors are looking at this in a very short amount of time and trying to price the work. This allows the builder to review and to be involved, and specifically Kinetic is providing the cost estimates for this work as well.
So then are we assuming, like, I mean, because normally we get a fixed price on a contract. So in this case, are we just doing cost plus, or like how does that work for the city?
That's a great question. Yeah, so we are once the design is complete, then Kinetic in partnership with our purchasing department will go through trade tenders, which we'll see all the work bid competitively, and from there we'll see open trade pricing, be able to work with the contractor and the trades on any refinements that are needed or value engineering, things like that. And then we'll have a choice to make in terms of continuing with the construction management phase, proceeding with construction management or rolling it into a fixed sum contract.
Okay, and if we were to stick with construction management, they charge a fee for managing and then we pay a straight cost for all the trade pieces? Is that what you're?
Correct.
Okay, thanks.
Thanks, Councillor McCollum and Councillor Jolicoeur.
Yeah, thanks. I'm just gonna have a follow-up on that because that was great report. Get really excited every time we get an update on this project, and happy to see all the amazing design elements that are being included. And thanks for being here with us online there, Jason. Construction management, can you break down, just in follow-up to Councilor McCollum's comments, the stipulated sum or guaranteed maximum price once the design is sufficiently advanced? So this is a new concept for us, and can you break down what those two are, the stipulated sum and the guaranteed maximum price?
Thanks for the question to the mayor. So we will not be using guaranteed maximum price. We will be using a stipulated sum, or that is the option, I guess, is to use a stipulated sum or with construction management. But really what it is that, yeah, the contractor is committing to doing in a stipulated sum, that they're committing for basically a lump sum contract where they're going to commit to doing the work for a stipulated price, for a set price. You know, changes can sometimes be inevitable in these projects, but at the same time, yeah, we're expecting both because the contractor is involved in these through the design, we're expecting probably less change and more familiarity with the project.
Thanks. My second clarification question, Mayor, probably to our fire chief. And one of the really amazing components that I think is first, my understanding in Courtenay at least, is the inclusion of a component of operations that allows for our firefighters to, I guess, enhance their protective mechanisms. There's been a lot in the news around firefighting equipment, and I'm wondering if the chief can speak to us a little bit around that asset and how he sees that being a benefit to our volunteer firefighters and our staff complement.
Through the mayor, councilor, excellent question. Essentially, as Jason was stating, the fire hall has been divided into a clean area and a dirty area. What we're able to do now is when our firefighters return from a call where they've encountered some smoke or some type of hazardous material, they'll be able to completely get out of their personal protective equipment. We'll be able to take that equipment, clean it on site through an extractor washer, which we don't have currently at our hall. We basically take our gear up to Cumberland to get it cleaned up at the hospital laundromat there. So we'll have that benefit to clean it on site. Our firefighters will then be able to enter into a decontamination area where they'll be able to clean themselves up of the stuff that they've come into contact with. And they'll be able to do it on the side of the building that's designed to be cleaned easily to get that out of the building as well, rather than our current situation where they would have to walk through the cleaning hall to get into the showers to clean themselves up before they go home. So hugely beneficial. Our firefighters will be able to return back home to their families clean. I mean, I'm guilty of it myself. Sometimes I'd rather than shower the fire hall, I'll hop in my truck and go home and do it. And, bad, but it's, sometimes we do that just of, we're tired and just want to get it over with, but we will be set up for it at the second fire station to be able to do it. And it will also provide us an opportunity with our firefighters that are operating out of our number one station, the one on Cumberland Road, to go up and use that resource until such times as we can look at either retrofitting something similar in the number one hall. It's basically a stopgap, but we'll definitely be set up and definitely in a better place to provide protection for our firefighters once this hall's up and running and this resource is available.
Excellent. Thanks very much for that. And Councillor Hillian.
Thanks, Mayor. 2 points. First, I wonder if staff would just briefly explain the rationale around the amount being borrowed exceeding the estimated budget.
Hi, Mayor and Council. Nice to be here once again. So this question came up during the budgeting process or financial planning. Originally, the fire hall was in the 2026 year at $23 million. Given that we've proceeded and got more accurate costing back, the decision was made, or the recommendation by myself was made, to bring the loan authorization bylaw down to $18 million. It still exceeds the pricing you see in front of us. However, since this project is 100% funded by debt, it becomes challenging if the project exceeds the value here to simply go out and get additional debt. It takes time to do that. So by using a higher amount in our loan authorization bylaw, we can complete the project. We have some buffer if costs come in higher than expected. Once the project is all done and the prices are finalized, council then gets to decide how much debt to take on. You can take on up to 18, but if it's less than that, council can take on 13 or 12. Council will also be given the option to a recommendation to throw different reserves, or we could tax high over the next couple of years to bring down the total amount borrowed to a level that council is comfortable with. So really the reason for the higher loan is an abundance of caution, given that it is never known what these projects cost once they come to an end, and to ensure that we have adequate access to cash to finish a project.
Thanks for that. And I did want to just acknowledge that I had the opportunity to sit in for the mayor and attend the fire department's annual dinner last month. Thanks for your great hospitality, Chief. And I think there's a really enthusiastic response to this project in our fire department, and a sense that not only their needs, but the needs of the community for extended fire protection are being addressed by this council. So I'm very pleased to support this.
Thanks so much, Councillor Helene. Appreciate that. And thanks again for standing in for me for the volunteer dinner. And Councillor McCullough.
Yeah, I realize I still have another question around this new process that we are embarking on. So normally what would happen is when we've gone out to tender and, entered into a contract, we essentially know the price unless there's some kind of like unexpected change and, we have a contingency, but generally we have pretty high certainty before a project has started what the cost of that project is. And so currently we're moving along. This project is going to be under construction probably in the next 3 months or so, based on the report. And we're currently at a cost estimate plus or minus 25 to 40%. So at what point will we know what the actual cost of like the project is with a much greater or a higher level of certainty?
Thanks for the question to the mayor. So yeah, when we reach our 100% detailed design milestone, Kinetic in partnership with us will go out and do trade tendering where they'll actually get the pricing. And so another advantage that we see here is let me back up. The pricing will come in, but the pricing is open book pricing. So we'll see all the costs for that have been submitted. There'll be some bid leveling and review and those types of things. But yeah, it will have transparency on those costs. So that will be in the coming months that we'll go through that process. And then at that point, then we'll have a decision to make about converting to a stipulated sum or continuing down the path with our construction management. But in essence, it's going to be those the bidders who bid that subtrade and Kinetic as a prime contractor leading the physical construction of the hall.
Your subsequent, you bet.
Yeah, and that's a good answer and makes sense. But that did remind me when reading the report. So will we not have any, are we going to get to 100% design before any of this goes out? Because in reading that we were at 70%, I had wondered are there some design elements that are determined later in the project, but the phasing is 100% then going out to tender?
Jason, help me out with that. Yeah, I think we're going to tender this at 100%. Is that right?
Correct. Yes. Yeah, we're targeting 100% design documents or IFTs as we call them by the end of this month. And then Kinetic is going to take about a week to review and then put it out to public tenders so subtrades can respond.
Wow, sounds very imminent. So this is very exciting. All right, we'll just receive receipts unanimously by council and move on to the changes to the provincial homeowner grant program, and I'll pass it over to Mr. Garvin.
Thank you. Mr. Langemar is going to give an overview of the briefing note he's prepared for council. Council may be aware there's a lot of things emerging in the public related to the previous provincial budget, and there are 2 items in this briefing note that we want to make both council and the public aware of. And all of them are outside the city's control, but they do have impacts locally. Over to Mr. Langemar.
Nice to be here once again. I wanted to highlight a couple items about changes to the homeowner grant. So we'll go on the way back machine. In 2006, the homeowner grant was $470. At that year, it increased by $100 to $570. Fast forward to 2011, carbon tax was introduced provincially, and the homeowner grant was increased for a northern and rural component that impacted all properties outside of the Lower Mainland, and that added an additional $200 to the homeowner grant. Fast forward again to 2027 with the repealing of the carbon tax. The provincial's 2027 budget, the province's 2027 budget repeals the additional northern and rural homeowner grant, bringing the total grant back down to $570. What this means to Courtenay taxpayers is that, so last year we had 9,524 homeowner grants claimed. So if we take that number and times it by $200, the amount of homeowner grant that's disappearing, we have an impact to the city taxpayers of about $1.9 million of money that has to come out of their pocket to pay municipal taxation. Now, there isn't a change to the city's budget or an impact really. It's just who's paying that tax bill is the change. Another item I wanted to identify in this was a change to the deferment program. In prior years, the deferment program was based on a prime interest rate minus 2%. And the interest was simple, so it was not compounding. You paid the same interest the day you got it until the day you paid it off. The change in the provincial budget is going to a prime plus 2% and changing the interest method to compounding. In the report, I identify that, there's a 4% swing in interest rate, but that compounding impact results in, I give an example, over 10 years and a deferral amount of $3,000, a $1,800 increase in the cost of interest for that same program. Now, the deferrals don't represent a humongous portion of residential taxpayers, but we have been seeing a slight increase in the number of people taking part. So back in 2022, 6.5% of the total residential folios took part in the program. In 2025, that increased to 7.6%. So we're seeing slow increases. One of the theories on this is we saw a significant increase in the equity in people's homes, given the rising house values. That can also allow people to qualify for the program. I provided some information about the minimum and maximum deferral amounts. Some people deferred $225. The highest deferral we had was last year, was over $10,000 in deferred property taxes. So it's quite a range of folks taking part in the program. And with that, I'm open to any additional questions.
Thanks for the report. Much appreciated. Again, getting that clarification for changes at the provincial level that are going to impact Courtenay residents. Really appreciate that. Councillor Zuliker.
Yeah, thanks, Mayor. I just wanted to share some comments, and I agree with the city manager. These are things that are outside of our control, but I think given the economy and the affordability crisis that we're in, this is a provincial policy that will impact several of our residents, including people who might be asset rich and cash poor, vulnerable citizens who might not be working. And we can see also there's the families with children programs, also young families. And it's kind of a double whammy, both the compounding and the increase from prime -2 or prime to prime +2 for everyone plus compounding. It's just not a good news story for residents across the province and Courtenay. And so I'm not sure how council feels, but I would be in favor of writing a letter, just sharing to the Premier and the Minister of Finance that our displeasure of this. I don't recall being consulted, whether through UBCM or other regional bodies of elected officials around the impact that this would have. I understand that this is specifically on the school tax component for the deferral, or sorry, the grant program, but specifically my concerns are around the deferment. And I appreciate our CFO highlighting an example, $3,000 tax deferral. The interest after 10 years is almost the same amount as the tax itself. And so it does have a significant impact on residents. And so I'll just table that and see if anyone else has any thoughts, but not a good news story for us and our residents. Thanks.
Yeah, thanks so much for that comment, Councillor Zuliker, and I would definitely support that. And we also have other levers at our disposal. We do have ABICC coming up, where we could potentially even bring a late resolution with the same intent and potentially get even more local governments on board with the idea. So that's another potential. But for the furthering discussion, I'll pass over to Councillor Frisch.
Yeah, thanks. Well, certainly it sounds like the province is thinking of new ways to make a little more money. I don't know how much it costs to run that program and what the cost is to the province, but yeah, 4% increase in interest rate does seem significant. I'm wondering if we know, did you mention how many properties, how many people took the deferral every year? Like, and I guess last year you mentioned a number.
Hang on one second.
In 2025, 944 properties took part in the deferral program. To give that some perspective, there are 12,300 residential properties or folios in the city.
Right. And is there a concern that they won't qualify anymore based on the value of their homes, or? Do we not know that sort of information?
I can't comment on that because it's all governed by the province, but given the increase in home values, people no longer qualifying doesn't seem like a larger risk. It's more the fact that folks that qualified and took part for several years are going to see a substantial change in the interest payable when they leave the program.
All right, well, thanks for that.
And maybe a point of clarity, anything that's already in there stays at the old rate non-compounding, or does everything start compounding? That might be more of a provincial question, but
I will have to get back to council on that one.
yeah. Councillor Hillian.
Thanks, Mayor. I had an opportunity to be at a meeting where the Minister of Finance was speaking, and this question was put to her by some very irate seniors in our community. And the minister's rationale is that many people were using this deferment as a way of getting, in effect, money at cheap rates, which they could then reinvest. And the theory of the minister and the government is that these changes will in fact dissuade people from doing that, and that people who legitimately need to defer because they can't afford to pay their taxes will continue to do so, and that the increasing equity in their house will more than compensate them when they eventually sell. Obviously there's going to be some people who are going to get caught in between that, whether you accept the minister's rationale or not. But I just thought I'd share that.
Thanks for those comments, Councillor Hillian. I don't see any further questions or comments. So on behalf of council, I'll accept the report begrudgingly, but maybe Councillor Jolicoeur, do you want to?
Yeah, thanks, Mayor. I mean, I didn't hear a ton of support around the table, maybe, but I would suggest a motion that council write to the Premier and the Minister of Finance sharing our concern of the change to the two programs.
Second.
Seconded by Councillor Cole Hamilton. Discussion, anybody? Questions or comments? Councillor Frisch.
Yeah, thanks, Mayor. I was going to suggest maybe we take it up the chain, starting at UBCM at this point, I guess. Might be, yeah, it might just give everyone more time to think about, what this change means. The argument that like on a $3,000 loan, $6,000 per year over 10 years, it could very well be compensated by increased property values. And the idea of people using it as an investment monies, I could see being problematic. So I'm just thinking maybe a little more thought before we fire off a letter is worthwhile. And there is always that opportunity to work with the other communities and see how everyone else feels as well.
Thanks for your comments. And Councillor McCollum.
Yeah, I mean, I appreciate the challenge, and I sympathize with people that are impacted by the change. But I do agree with the finance minister's point that this program has been used by people as a means to access very low interest funds and use that in order to benefit their financial situation. And it's unfortunate that happens, but when you have a wide open program, eventually it needs to be re-examined. And we're in a fiscal climate in BC that the credit rating of the province has been downgraded the last 3 times it's been looked at, and that's impacting the cost of borrowing and what programs can be funded. And inevitably, the province needs to look at where money is being spent and look for ways to address that. So, and this is one of them. There's going to be people that are more impacted than others every time a fiscal decision is made. But I actually think that there's more work that the province needs to do on finding ways to address the deficit. So I personally can't endorse a letter that turns around and tells them to look for ways to provide more financing, and in a time when we really need to get serious about the provincial deficit. So while I appreciate the thought and the concern for residents and how this will impact them. It doesn't align with the greater concerns that I have around the fiscal situation in BC right now.
All right, thanks for your comments. I don't see any further comments, so I'll call the question. All those in favor? Any opposed? And I'm counting 2 opposed. Councillor McCollum and Councillor Frisch, and I believe Councillor Morin and Councillor Cole Hamilton online were in favor. So motion carries. All right, and I'll accept or receive the briefing note on behalf of council, and we'll move on to Lake Trail multi-use project update, and I'll pass it back over to Mr. Carpenter.
Yeah, thank you. Through the mayor to council, we have an opportunity with a briefing note in front of you to give an update on council. The Lake Trail multi-use pathway has been an incredibly important project, and it represents a partnership with electoral area C of the CVRD and responds to input both from school, community, and the big picture in the area. So I'll turn it over to our manager, Mr. Pitcher, to give an update.
Thank you, Jeff. Yeah, I'm here to provide an update on the second phase of the Lake Trail Multi-Use Pathway Project. This project is focused on improving safety and connectivity between Lake Trail Community School and Arden Elementary. Phase 1 was completed last fall and delivered a portion of the pathway along with some targeted road and drainage improvements. Phase 2 will complete the remaining section and create a continuous route along Lake Trail. As we advanced the design, we encountered environmental constraints related to Arden Creek that required additional federal permitting. I'm pleased to report that the Fisheries Act authorization has now been approved, allowing the project to move forward while ensuring the necessary environmental protections are in place. Construction for phase 2 is planned to begin this summer. Once complete, the project will provide a safer, more accessible route for students and families. We do have Chantel Richard and Emma Rose online. Chantel's our engineer of record, and Emma is the engineer in training, here to support any discussions. So with that, I'm happy to take any questions that you have.
Excellent. Thanks very much for that. And I believe Councillor Morin.
Thanks. Thanks, Mayor. I did notice, I think it's an error in the report where it talks about the contribution from the electoral areas, and I believe it was Area C that contributed, not Area A. I think it says Area A. I don't have the screen open, but
Mr. Pitcher?
Thanks for the question, Councillor Morin. Someone's going to have to help me. It was Director Grieve, I believe, who.
Yeah, so that's Area C.
Area C. Yeah.
I just wouldn't want, I wouldn't want the Area A director to, give us grief that we've committed him to 180,000 or whatever it is. And then just quickly around the, so it looks like the phase 2, the cost has come down a little bit from the previous estimate.
Thanks for the question, Councillor Morin, through the mayor. Yeah, we're seeing some efficiencies there. Maybe what also you're seeing there is the portion of the bike lane that is on the south side of the road that we are pushing with support from Director Shaw and the operations team, that we're going to do some of that line painting in 2027. Which is how some of the other bike lane portions were painted previously. So that does provide us some additional capacity there, or a reduction in cost estimates.
Right. Thank you.
Excellent. Thanks, Councillor Morin. And I don't see any further questions. All right. And we'll receive that unanimously by council, and we'll move on to bylaws for first, second, and third reading, starting with the 2026 loan authorization bylaw.
Hello, council. Nice to be here once again. So before you have 3 loan authorization bylaws for a total of $23.5 million in borrowing. This is to fund the 2026 capital projects. We have Raidwood Road, Storm and Road portion, $3.5 million. The Ryan Road sidewalk, Sandwick to Braidwood section, $2.2 million. And then the east side fire hall at $18 million. Loan authorization bylaws require electoral approval prior to adoption through referendum or AAP if the municipality exceeds an annual debt servicing threshold. The city of Courtenay is below this threshold and can adopt the loan authorization bylaws without electoral approval through Part 2, Section 7 of the Municipal Liabilities Regulation. The city will consume 54% of this approval-free limit with these 3 loan authorization bylaws ahead of them. The city will have an estimated $33 million of remaining debt capacity after these loan authorization bylaws. To put that into perspective, the 2027 capital plan contains $16.7 million of borrowing. So the city is still well within its limits with regards to debt utilization. When looking at the different projects, you'll see some have various funding sources. And one of the questions that comes to me is, when does the municipality choose to use debt versus reserves? And one of the things that has always resounded with me is using debt to fund a project makes the future generations pay for the services we receive today. When using reserves, it represents past generations paying for future services. So it's always good to kind of balance the two. The folks using the services should be contributing. The folks using up a certain asset should be contributing to the replacement of that asset. And I do want to highlight that overall, the city will consume 26% of its allowable debt with these new bylaws. That's an increase from 17% in the prior year. So again, we're well within reason on our borrowing capacity and our borrowing amounts currently. With that, I'm happy for any questions.
Excellent. Thanks very much for that. Looking for any questions or comments. And there is a motion. Councillor Hillian.
Thanks, Mayor. I actually meant to ask this earlier. I'll ask it now. Have we given up on the possibility that there may be any grants available to help with the financing of the fire hall? I thought that there'd been some changes to infrastructure funding that made grants for fire hall construction allowable.
Adam seems very eager. Over to Mr. Pitcher.
Adam, through the mayor. Yes, we applied on the SPF grant through UPCN, if I'm not mistaken. Sorry. But yeah, so we've reached out to the grantors in the last couple of weeks. They've completed their initial assessment and are now going through the technical assessments. I think they gave us a fuzzy time of summer of this year. And the max you can get is $12 million. Yes.
Well, thanks very much for that update. That sounds good. Excellent. Okay, recommendation 1 has been moved and seconded. Any questions or comments? Seeing none, all those in favor? Any opposed? And motion carries. Okay, number 2, any questions or comments? Seeing none, all those in favor? And finally, all right, any questions or comments on recommendation 3? Seeing none? Oh, Councillor Schilliker. It is quiet, but your light is on. But you can hear me. They're all set at the same volume. Maybe turn it off back on again. Let's just see if it needs to be rebooted or something. Try the other mic. Nothing there either. No. Done. Yeah, it's the computers. Mine is, but I haven't turned it off and on again. And Councillor Hillian and Frisch were just chatting. Can you hear me, Councillor Cole-Hamilton and Councillor Moran? Yeah, okay. Do you want to try your mic again? Oh, yeah, let me click the button. Now, when this has happened in the past, there has been a wiggly little cable not plugged in somewhere between, and just at the backs, they're just in the backs of the mics. You don't have to look underneath. Yeah, or yeah, come on over this way.
Does this one work? It's okay, I don't.
Yeah, I'm not check. Okay. Okay. For the record, Councillor Schilliker has withdrawn his comments that he was going to make. No. Okay. We may want to take a pause and figure out what's happening with the sound system potentially, but we're on our last vote here. And so all those in favor? Any opposed? And motion carries. And that brings us to property tax bylaw 3217/2026.
First, second, and third reading.
Second.
Okay, first, second, and third readings have been sent. I'll call a question. All those in favor? All right. Are there questions or comments? Seeing no questions or comments, all those in favor? Any opposed? Seeing none opposed, motion carries. Going into council reports, I will, given our time, forego council reports. I think today, maybe just a special comment about the Comox Treaty Act event that we attended yesterday in Victoria, where some of us attended from the Comox Valley, along with Comox First Nation, on their path to recognizing their treaty rights into the future. And it was an amazing event. And with that, we do have an in-camera resolution. Okay, it's up on the screen. All those in favor? Any opposed? Motion carries, and we are adjourned. Does my mic